Welcome to the February 23rd, 2021 regular meeting of the Calaveras County Board of Supervisors. Madam Clerk, can we read off our closed session items?
Closed session item 1, pursuant to Government Code 54956.9D1, conference with legal counsel re-existing litigation, Calaveras residents against commercial marijuana versus County of Calaveras, Board of Supervisors of Calaveras County et al., Calaveras County Superior Court cases number 19CV44446. Item 2, pursuant to Government Code 54956.9D1, conference with legal counsel re-existing litigation, California Sport Fishing Protection Alliance versus Eastern San Joaquin Groundwater Subbasins of Sustainability Plan et al., Stanislaus County Superior Court, case number CV 20001720. Item 3, pursuant to Government Code 54956.9D1, conference with legal counsel re-existing litigation, Matthew McCulloch et al. Versus County of Calaveras et al., 3rd District Court of Appeal, case number C088001. Item 4, public employment, pursuant to Government Code 54957B1, titles Health and Human Service Agencies Director, Public Works Director, Planning Director. Item 5, public employee performance evaluation, pursuant to Government Code 54957B1, title County Administrative Officer.
Thank you, Madam Clerk. At this time, if there's any public comment on any or all items, you have your opportunity.
There is no public comment at this time.
We'll give it a little time for the delay. We're good?
We're good.
Thank you very much. And at this time, we'll close out to closed session. Regular meeting of the Calaveras County Board of Supervisors. Could everyone please stand? Mr. Sheriff Basilio, can you lead us in the pledge today?
Absolutely. Pledge after me. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Sheriff. At this point, we'll move on to staff announcements. This is a time for county staff to provide updates of upcoming county events that may be of interest to the public. I would like to start, yes, ma'am.
Closed session items.
Closed session items. So my apologies, Ms. Clerk.
Closed session items will be reconvened later this afternoon and will be reported at the next meeting.
Thank you. Okay, now back to staff announcements. At this time, I would like to ask everyone to take a moment of silence. Michael DeMasters, Gabe Morton, very young gentleman, involved in the community, long-time resident, passed away a few days ago in a fatal car crash. Can we just give 30 seconds of silence for the gentleman? Thank you. Our hearts go out to the family and everyone involved. Mr. De Basilio, do you have any announcements you would like to make at this time?
Morning, Chair, Supervisors. I just wanted to reiterate about Mr. DeMasters. I knew him very personally as well as a lot of people in this community. I'm going to take this off. He was an intricate part of the Fish and Wildlife team. He worked with us on some marijuana grows. And again, a lot of our deputies and a lot of the community knew him very well. He was a very nice and very well-liked young man. It's a very sad loss. And on a personal note, I will miss him because we used to go four-wheeling together. So I'm very sad, and our condolences go out to the family. The Sheriff's Office is very saddened by this, so thank you for what you said also. And I hope the family just know that they're in our prayers. Thank you.
He worked alongside us with Fish and Game. He showed up to some, like the kids' fishing day up in Murphy's, stayed involved with the community. Just a great person overall.
Yeah.
So true loss.
Yes, it is. Thank you.
Is there any other staff announcements?
Yes, good morning, Chair Stopper and respective board members. Michael DeMasters will be missed. He was a wonderful, kind, and very professional and intelligent person. We worked with him on several occasions, not only with EMA, but also with our Office of Emergency Services. We will miss you, Michael. Last week, I had announced we will be scheduling free rabies clinics in the upcoming months, and I'm happy to report our partners with Friends of Calaveras Animal Services, Focus, have confirmed dates for the clinics. The clinics are scheduled on the following dates here at the Calaveras Government Center. Those locations might change, and so I will notify the public. This information will be posted on our website as well. The following dates for our rabies clinics for 2021 are April 3rd, May 1st, June 5th, September 4th, October 2nd, and December 4th. Now, please look for flyers that will be distributed and displayed during the upcoming Board of Supervisors meetings, and also look for the posts on our website, also with Cal OES and our Economic Development Department, that we will be sharing with our community. That is all I have. Thank you.
Thank you, Ms. Medina. Is there any further staff comments? Or are there?
Not at this time. No, there's not.
Thank you very much. At this time, I would like to move on to the public health update. Receive an update presentation from staff on COVID-19 novel coronavirus. Mr. Leach.
Good morning, members of the board and residents of Calaveras County. Thanks for having me again. It's my honor to be here and as interim director of HHS and try to guide us through this difficult transition time. I'm going to say that I'm going to try to be a little bit brief and try to keep this to about 10 minutes or less, because I know that Doug Archer, who's on the line, I want to have him available for questions, and my understanding is he needs to be off by about 10 o'clock this morning. So I'm going to try to get through this fairly quickly and then be more available for questions at the end. So here's the data for this week. As of this morning, we have completed a total of 22,959 tests. We have had 1,901 positive tests. We have 37 active cases, 1,839 recovered, 2 active hospitalizations as of yesterday, although we'll get an update from Mr. Archer. 25 fatalities recorded to date. And on the vaccine front, we have administered a total of 9,215 doses to Calaveras residents. Last week, we did not receive any vaccines at Public Health, and obviously the vaccine distribution, as has been publicized in the media, was hindered by the weather throughout the country and the massive storms that hit. So our understanding is those vaccines are still coming. They've just been delayed. But that said, we're now on 2 weeks where 2 weeks ago we only received 100 doses, and then last week we received 0. So that has created some challenges behind the scenes, but we do anticipate getting a flood of vaccines coming in over the coming week. Few important notes for now. Oh, sorry, we're still in tiers, the same tiers, Phase 1A and Phase 1B Tier 1. We're still in the purple tier, or the most restrictive tier when it comes to the blueprint for a safer economy. So the state tiers, as far as what businesses can open, we remain in the purple tier right now. The numbers do, I'm sounding like a broken record, the numbers do seem to be trending very quickly in the right direction. We are close, really close to getting out of that, so I will encourage people to keep getting tested. Our testing rates as a percentage have come way down, so a lower percentage of people is testing positive, and that's a great thing. Our case numbers still need to come down a little bit for us to move into the next tier down. So we will get an update on that. They'll run the numbers again next week, and fingers crossed, I'm cautiously optimistic for next Tuesday that we could see us coming out of that tier. Again, that's not a guarantee or a promise, but if you follow the new cases per day, it does look encouraging. Okay, testing. There is free testing again today at Ironstone, 7 to 7 out in Murphy's, and tomorrow at the Armory in Copperopolis from 9:30 to noon. I commented on vaccine supply, but I'll reiterate that we're getting very low on vaccine supply. We have enough to get through what we have scheduled at Public Health this week, which are more small, targeted efforts this week. We specifically did, we've got a couple rounds of second doses that we're working on, and then we also have the 2 smaller travel clinics. So we have reached out to an aged population over 75, specifically in West Point and Copperopolis. Now, those are smaller pilot clinics. Those clinics were specifically designed to test our registration software, as well as to reach a very difficult to reach population. So we had a very limited number of vaccines to administer in those sites, and some of that was intentional. As we move forward, as we get more supply, these will keep going. We plan to continue to do travel clinics as supply allows. Okay, so I know that we've gotten a lot of questions and some people being frustrated because they see that there's a clinic in West Point and the slots are already filled. That was partially by design. We wanted to reach a specific population that, frankly, it's a little harder for them to travel to the San Andreas site where we have hundreds of vaccines being administered. So up there, we wanted to pilot a software and reach a specific targeted population, which is part of what the state expects from us as a local public health jurisdiction. So that's what we're up to this week. We have another effort going on in Copper later this week. Those slots are all full. I realize that's frustrating for people who would have liked to have gotten a slot. We only have so much supply, and we needed to keep these small while we're testing this. That's why we labeled them as pilot clinics. Okay, it's not a one-time thing. It's not the only time we're going to be doing it, and these aren't the only locations throughout the county. Again, they are not the only locations throughout the county that we will be doing in the future. So stay posted for that. We will have a rotating schedule, but right now we have to peel back, wait until our vaccine allocation increases and frankly stabilizes after this weather storm, where frankly we didn't get very much vaccine the past 2 weeks, and we need to make sure that that supply is coming before we're setting appointments for those. All right, moving on. I've heard some complaints about, is Calaveras getting their fair share of supply? Supply is an issue everywhere, okay? And I'm not defending the rest of the country or the rest of the state, but if you look at the numbers, we are ranked 44th in county populations. There's 58 counties in California, and we have the 44th highest population. And we're 41st in doses administered to our residents. In other words, proportionately, we're really close, but actually slightly ahead of the per capita administration of doses. So we are getting a fair supply. The problem comes in how the vaccines are getting here, and what if I'm being nice, I'll use the word fluid, right? It's a fluid situation, to say the least. The state has changed the rules. The feds have changed the allocations so frequently that it just leaves us constantly guessing what we're going to get instead of having a steady supply. And just when things looked like they were starting to get steady a few weeks back, when I would report that we were getting 700, 800, 1,000, that was getting a little more consistent. Then what happens is the state goes out and does this third-party administrator contract. And frankly, there has been a lot of confusion, a lot of frustration. I'm really frustrated with that process. When we hear that Blue Shield and now Kaiser are, getting these allocations and then making decisions that impact us, it's really frustrating. Okay, then you see the feds peeling off vaccine allocation and giving it directly to pharmacies throughout the country. Well, that's frustrating from a communication standpoint because I want to give clarity to the public and clarity to the board. And so when those vaccines are being routed and we don't have any control or clarity over what's going to the pharmacies, it becomes really frustrating for me to give you guys the transparency and clarity that you need. Now, that said, if we all take a step back and look at what's happened, last week, a week where we really didn't receive any vaccines and hardly any the week before that, 2,300 doses were put into arms of Calaveras residents. And a lot of that, frankly, is because of the help that the pharmacies are giving in this fight now. So at the same time, while I'm saying that it's confusing and difficult and frustrating from a communication standpoint, from an execution standpoint, doses are still going into arms, and we're thankful for the help of places like CVS and Rite Aid and Walgreens, and I know Walmart is coming on board, Safeway is coming on board. So a lot of pharmacies throughout America helping to put vaccines into arms, and that's a good thing. It's just really confusing because it's left a lot of us in the public, trying to scramble and figure out what's the best way to get the vaccine. And we've tried to communicate that as much as we can, but understand there's a lot of confusion on our end and questions that need to be answered by the state and by their new third-party administrator, Blue Shield. To that effect, we in public health have a meeting with the third-party administrator this week, and so we hope to get more clarity and some of our questions answered because there's a lot of miscommunication coming to us. The state will say one thing, we hear another thing in a press release, or we hear something from the third-party administrator directly. So we have a lot of unanswered questions, and hopefully, by the next time I'm updating you guys, we'll have a little bit more clarity on the situation and more stability on the flow of vaccine. That said, let me rewind and say over 2,000 doses a week are now going into arms. Whether public health is the one giving you a dose, or Rite Aid, or Mark Twain Medical Center, or your local physician, if you're the person getting that dose, again, and I said this last week, I don't know if it's that important to you. The important thing is that you're getting an opportunity to get the vaccine. And at 2,000 plus vaccines a week, you do the math and try to get us to the 60,000 number that I've put out there, and that's 30 weeks. Take away the amount that's already been done, and really we're at just about half a year or maybe just under half a year. And that's assuming no large increase in supply. That's assuming no transition to a single shot. So I'm sorry if this confuses some people. I'm trying to be as transparent as possible. But frankly, if we could get to, late summer and have everybody that wanted to get the vaccine vaccinated, I think that's ahead a lot of the timelines that we've heard in the media from day one. So I'm encouraged by that. Looking at the math, I am hopeful that not only continues, but speeds up a little bit. And we're happy to get the help where we can get it. We just implore the state to make decisions and stick with them, communicate with us, and make sure that you don't make one decision one week and then pull back from it the next week, because it really impacts our local efforts here. And we are advocating. I know that our supervisors are advocating through their channels, as well as admin and everybody else who's involved in this fight from a government standpoint. Okay. I'm going to now pause and turn it over to Doug Archer so that he can give an update from Mark Twain Medical Center, and we can be available for questions afterward. Doug, you ready to go?
Yep. Thanks, Sam. Morning, supervisors in Calaveras County. So from a hospital standpoint today, we've got one COVID inpatient that happens to be in the ICU and happens to be on a ventilator. They were just admitted yesterday. Our total ICU census is 3, so we have 5 ICU beds available, a little better than 50% capacity. For the Mark Twain Medical Center vaccine program, we were kind of hit with the same thing, storms and blizzards in Texas, and also I think some of the changing of the guard with Blue Shield and Kaiser. We did not receive any vaccine last week or this week, and sadly we had to postpone about 120 appointments between yesterday and today, just because we didn't have the vaccine to give. That is not unique to Mark Twain. That is not unique to Dignity Health. That is a statewide issue. And I, kind of the same sentiment Sam shared. I'd be lying if I said I wasn't frustrated as well, but I don't think there's any, deceitful business happening here. I just think this is a monstrosity of a effort. And, what I want to make sure, and frankly what we should all be very grateful for, is the partnership that we do have with public health. I believe public health will continue receiving vaccines. The Dignity Health supply very likely will be, reallocated towards other pharmacies and, the mass vaccination centers. But I think with our partnership with public health, we'll be able to, we've got people that can push plungers and give injections. And with our partnership, I think we'll be able to keep on pace, if not even speed up the pace. So I remain optimistic. Very hopeful that the numbers will continue going down. That's kind of what we've seen here. Yesterday we saw 33 patients in our ER, and only 4 of them came in for COVID type things, be it a test or perhaps a little bit of a COVID symptoms. But again, only 1 positive patient in the house right now. I think that's really about it. I should get some more information tomorrow from the Dignity Health side about vaccine distribution. But if I had to guess, I think we will see our allocations, as I mentioned, decline pretty significantly, and hopefully reallocated to both pharmacies and to public health. And I 100% agree with Sam. This is not a business development venture here. We're not trying to corner the market. We just want to get as many vaccines in our community as possible. And I, for one, don't mind if it's CVS, public health, private physicians, whoever, providing that vaccine as long as we get there. So that's all I've got. Happy to take questions.
Any questions, board members? Ms. Calloway.
Mr. Leach, I have 2 for you. One, is there a way we can get the positivity rate, since we're trying to encourage people to take the test, and that's the other metrics besides the case rate coming down. My second question is, does Blue Shield give the allocation to public health and to Dignity, who then gives it to Mark Twain? Oh, and Mr. Archer, I do have one for you, too. Mr. Leach?
You asked, does Blue Shield, so Blue Shield is taking over as the third-party administrator, and yes, they would be the ones in control of our allocation once they've fully taken over. I'm as confused as anybody as to what that switchover date is and how the allocations are functioning now. But we have a meeting with them later this week to clarify some of that. Dignity would be the ones getting the allocation through Blue Shield as well, if they do. And that's the problem, is we're trying to get clarity on that and, you know, who they're giving this to. Are they just giving it to the local public health jurisdictions? Are they giving it to the MCEs, as was happening, the multiple county entities, as was happening before? So it doesn't look real encouraging for Dignity getting a supply, which they then pass down to Mark Twain. Here's the message I would assure the public of on this is, you know, Mark Twain has been a great partner to us, and they plan to continue helping us. So whether, you know, they want to send us, you know, directly at public health a few thousand vaccines, or they want to split that and send some to Dignity and some to us, ultimately we're going to work together. And as you just heard Mr. Archer pledge, they're going to help us with vaccinators. They're willing to help us at clinics. That support means a lot, and they're in this for the long haul. So, you know, it's confusing, it's frustrating, because just when we felt like we were getting in a rhythm, then they stop, you know, sending to Dignity. Whether that's temporary or permanent, we'll find out. And then the storms hit, and we get interrupted. So we're frustrated, but we're still getting people vaccinated, and the skies have opened up. We expect shipments this week. We expect a lot of shipment because, frankly, they owe us a lot the past few weeks. Your other question about positivity rate, those numbers, the current numbers are going to be released later today, so I can't give you the current numbers for the positivity rate. I just know that we are slated to drop, let me think about this, so there's two metrics that we go by, Supervisor Callaway, that the state uses, and one of them is the testing positivity rate. On that one, we have come under the required 8%. I don't have the exact figure. And then on the other one, we still are not under 7 cases per 100,000 population per day. Sorry, that's a lot to follow. But that's what it takes to get into the next tier down, is for us to have less than 7 new cases per day per 100,000 population. So right now, my understanding is, according to the state statistics, which are a week in arrears, we are still above that number, although it's getting really close. So I'm optimistic that it'll be about a week. Now to be clear, both of those metrics have to be under for us to move to a tier below. If we're out of line in either metric, then they put us in the highest tier. Okay, so we are hopeful, and I think we should continue to do what we've been doing, because if you remember last week, our testing positivity rate was still much higher than what it needed to be. Healthy people have been getting tested. That's a good thing. We've kept our rate. We've gotten our rate now under. We just need less people to have COVID. And frankly, since it's a week in arrears, you know, some of that damage, that was already done. The people who got COVID already had COVID. They already tested positive for COVID. So there's really nothing actionable that we can do about that, except be patient and really hope that next Tuesday we can. Did that answer your questions, Supervisor Keller?
And where would we find that location, that information, besides calling you?
Yes, I will pull that up and tell you. It should be on the Blueprint for a Safer Economy page. pulling it up now as I give a blank stare into the screen. Yes, so it's the covid19.ca.gov/safer-economy/ and I'll read that again. covid19.ca.gov/safer-economy/. So that's the webpage where all that can be found. That's a state website, Blueprint for a Safer Economy. If you didn't follow that, just put in Blueprint for a Safer Economy in your search, and it's going to come up.
Okay.
You can enter Calaveras County, and it'll give you the latest risk levels, and as well as the charts that I refer to. So for anybody who wants to play data geek like me and get in here and check it out, there's a map on that page with statewide metrics. You can hover over Calaveras County and then click on it and see where we're at. You'll find similar things in our neighboring counties. There's my understanding is there are some counties that are coming out this week, but our local neighbors seem to be in the same boat we are, and that hard data will be out there later today, from what I understand.
Okay, thank you. Mr. Archer? Okay, you can hear me. I can't see you, but I'm sure you can hear me. You mentioned that Dignity's allocation is being given to pharmacies. Could you explain that a little bit more and the impact that would have on our 65 plus? Thank you.
Sure. And I don't know for sure that they're diverting or reallocating to pharmacies. All I know is we are not getting it. And that goes for Dignity Health across the state. So I'm only assuming that those doses, those vaccines are being reallocated out to pharmacies or to public health. I do know that this is the same situation for all of the other health systems in California, which kind of leads me down that path to think that they're reallocating those doses elsewhere. With CVS ramping up, Rite Aid, Walgreens, Safeway, Walmart, all those entities. So for us, what it means is, as of right now, we are not scheduling any first dose appointments. However, I believe once Texas thaws out and the shipments arrive for the county, that we'll be able to partner with the county using the county vaccine supply to start up our clinics again.
Thank you, Mr. Archer. Thank you,
bet.
Mr. Chair.
Mr. Garamendi. And let's, in the interest of time for Mr. Archer, could we start out with questions for him, because he has to leave at 10 o'clock, and then we can come back to Mr. Leach in a moment.
I think it's a good idea. I do not have a question for Mr. Archer. I have a compliment for him, but I could let the questions go first.
Go ahead, sir.
Okay. First off, Doug, Sam, thank you very much for all the work that you guys are doing together. You guys are a good partnership. There's a lot of trust there and between Mark Twain and Dignity and the county, and that is really valuable to all of us. So I want to thank you guys very much. I hear what you're saying about the confusion on the vaccines and distribution. That's horribly frustrating. We finally just got our system in place, and then they go and they change the rules. We know you, Doug. We know you, Sam. We know your families. You live here. We trust you. We don't know the ownership and leadership of CVS or Walgreens. We may know our local managers, but thank you for being on this, and we'll see if we can fight that back and for that partnership. So my questions are actually, I wanted to do two follow-ups from last time we updated, and this first one's for Sam, and I wanted to know, and hopefully it's the last time I'll ask this, but how is our partnership going with OES and developing a structure that allows public health and your team to actually survive this marathon, this sprint that turned into a marathon? Sam?
Yeah, it's good. John Osborne's been great. We've been meeting. I say we're meeting once a week, but that's in a structured format. John and I pretty much talk every day. He's also working with our structure at public health to make sure that we are preparing for, clinic planning, which sounds like a broken record, except that if, this is a perfect example right now of what's going on, where because we're so backed up on doses, we kind of are fingers crossed that we could get a very large allocation all of a sudden, which is kind of what we've been planning for behind the scenes, right? What are we going to do if we suddenly get thousands of doses instead of hundreds of doses? So our partnership with OES has been helpful in developing a lot of planning and logistical support around that, and developing, going from, I say small, medium, and large scale clinics. Small being maybe we have 40 to 60 doses to do with our elderly populations in these targeted outlying areas. A medium-sized clinic would be kind of what Mark Payne is doing, or for us doing a couple hundred doses, out there at public health or at the library, somewhere here in San Andreas where we're centralized. And then, a large-scale clinic would be doing, I hate to put a number on it because I don't want people to hold me to that, but let's say significantly more than a couple hundred. So what we're doing with OES has really been kind of planning for that small and large and then intermediate steps based on the allocation supply fluctuating. So John's been really helpful in that. We appreciate his support. Some of the other things we're doing just are more in the weeds of working with the call center and how we communicate with people, how we use them as liaisons for messaging, making sure that we clarify some of the communication issues that I've had, that I take ownership of in trying to make sure that things that I advertise through one medium end up being communicated through all mediums that we do, because I realize that people consume information in different ways. So, that's been a learning curve on my part. Doing something that's this wide scale is clearly a challenge, and plenty of people in the public and frankly, those of you that supervise me, pointing out some of those inconsistencies. And I do listen, and I do try to correct them as I go. But a lot of that comes down to just, my learning curve and the difficulties of, frankly, what anybody would be going through in this position right now. And I know you guys are understanding of that, but, accept my apologies and the understanding that we try to make incremental improvements every day. And sometimes our best isn't good enough, but we're doing what we can. We're darn near completely out of supply, waiting on more shipments, and that's a good thing. Doses into arms. I said that from day one. So that's the part I'm proud of. Doses are going into arms. We never got caught, sitting here not knowing how to get rid of doses that we got. And that's probably the most important thing in all of this. But, I understand communications can be improved, and OES, I think, has been helpful in partnering with us in doing that.
Thank you, Sam. I do, as I continually mention, I want to make sure that your team comes through this crisis intact as well. And so spreading the load is a good thing. You guys are all working incredibly hard. I'm very grateful for it. Second question I had was, last week I asked about funding. And I wasn't sure whether I was going to get that offline or online, but we're now back online and I haven't gotten the information. So tell me where we are in the $1.7 million that we were allocated last fall.
Sure. And I see Marcos Munoz is on the call and he just unmuted, but Supervisor Garamendi, out of respect for Doug Archer, who's on the call and needs to go, can we just set this aside for just a moment to see if any other supervisors have questions of Doug before he goes? Absolutely. And then Marcos, perfect. And then Marcos will fill you in on that because he's looked at that and is more, able to give you a pretty succinct report on that.
Absolutely.
Thank you, Mr. Leach. Gary? Mr. Hellman. Okay. And Ms. Fullendorf? We don't have any further questions at this time for Mr. Archer, so we can get back into the business of grilling you, Mr. Leach.
Well, Doug, that means you're off the hot seat and I'm back on. That didn't last long. Thank you for your support today, Doug.
Thank you, Doug.
Agreed. Thank you. Thank you all for the support. We'll get through this.
All right, Marcos, you're up.
Good morning, members of the board. Marcus Munoz, Fiscal Administrator for Health and Human Services. So there was 2 rounds of funding, the $2.4 million, which we will be receiving a webinar on March 5th to go over the guidelines regarding that, but it looks like the one in question is the $1.7 million we did receive last fall. Of that $1.7 million, the majority of the budget is focused on salaries and benefits within for staffing related to COVID. The staffing on October 27th, we took to the board an item that added 3 limited term positions specific to this funding. As of now, we have been able to recruit and hire one of those 3. We have had interviews for the other one, and hopefully we will have the other 2 hired here very shortly. Additionally, that staffing includes 12 extra hire positions. We have been working diligently to conduct interviews for those positions. We have found several good candidates as well as others who have not worked out, but we continue to do the recruitment to hire those positions. That is where the majority of the expenditures lie. Again, out of the $1.7 million, there are 6 strategies we are able to use the funding on. Excuse me, on 4 of which are pertain to Calaveras County, 2 which do not. And again, it is heavily the budget we have focused on salaries. Is there any specific questions you would like me to answer, Supervisor Garamendi?
Yes, in last week's meeting, you referred us back to the November, I think, 17th meeting where we approved accepting this money. That item didn't list how you were going to spend the money other than some very broad categories. I would ask, and we do not have to do this here, but I would like to see what the budget is for that money and at least how it's allocated. Most of the money being spent on 3 limited terms or 12 extra hires, that's pretty broad. And maybe that's a better thing we could do offline, but I would ask that perhaps you and I have a call or you share this information with the board, because I'm very interested, and I need more detail than those 2 broad categories you brought forward just now.
Absolutely. And definitely take care of that.
Thank you. You have my phone number. Thank you, Marcus.
Thank you, Supervisor Garamendi. Supervisor Toffman.
Yes, good morning, Sam.
Morning.
My questions have to do with what I've been hearing from the public, specifically in my district in the Valley Springs area, moving down towards Burson and Wallace. Your dashboard on the website, I'm hearing, and I was there and spent a lot of time there yesterday going through it. There's more information you're sharing on Facebook than anybody's posting on our dashboard. And quite frankly, from what I'm hearing, is the older generation that we're trying to serve, 75 or older or 65 or older, a lot of them do not use Facebook. So they go to the website, the Calaveras website, and there's no information. There's not even any updates to any of the announcements since January 15th. Until yesterday, something appeared that all the Copper and West Point spots were full, even though it never announced that on that website ever, that you were going to have clinics there. Just some of the complaints, I think if you're going to post something on Facebook, the person who's doing the posting needs to go to our website and keep it updated. So everybody is aware, because most people are going to go to our website first. They're not going to go to a Facebook page. The other thing that I want to bring up is, and I'm hearing, is you go to the dashboard, and several months ago we changed from posting numbers from specific districts to zip codes. And you click on down at the bottom right-hand side, zip codes, to get some information, and you move your cursor, it shows a graph, and you move your cursor onto the graph, and it gives you specific numbers. And I'm even perplexed myself as to what's going on as far as testing or vaccination clinics, when you click on the zip code 95252, it is the biggest hotbed in this county for cases. It's over 700. No other zip codes even combined, and some of those zip codes are combined, are even close to that. Yet we continue weekly to test in Ironstone. Instead of coming down here and testing right in Valley Springs, or that zip code, weekly there where the hotbed is. Or even setting up any vaccination clinics. It seems to me if we're going to fight this thing and we're going to do some good, we need to concentrate where it's been the most cases since almost the beginning of this thing, and not skirt around it. Let's get in, roll up our sleeves, put our boots on, and go in and see what we can do to get these people tested there, because they're not going to drive to Ironstone. We do, once in a while, we do for 4 hours at the firehouse over in Jenny Lynn. But in my opinion, and I've heard this extensively from people, is they need to put the testing weekly at the Vets Hall or some other place in Valley Springs where we can get numbers accurate, and we can get the vaccines to these people, and get the major hotspot of this county taken care of. That's what I'm hearing, and I'm hearing it more and more frequently, answering those questions, trying to answer those questions. And again, one of the major ones has to do with our website and our dashboard not providing any information other than clicking on and getting statistics and numbers, and that's it. So if you can address that for me, I'd appreciate it, Sam.
Yeah, that's fine. On the dashboard, that's fine. If it's the will of the board that you want us to add more information or change the layout, we're happy to hear that. The dashboard, again, as we said in the January 15th press release, we said that the dashboard was taking the place of the twice-a-week press releases that were basically data-driven. So those data releases that we had twice a week then became available Monday through Friday with updates. So the dashboard provides you more immediate and accurate information because it's on a daily basis, Monday through Friday, excluding holidays. So that's why we went to the dashboard, plus just the time that we spend putting out the press releases with information that frankly is on the dashboard could be spent doing other things. And so you guys understand how manpower is an issue, and we're challenged for time and resources. So that was a conscious decision that was made, frankly, quite a while ago. But I've heard the same feedback that you've heard. I don't know whether that's a few upset people who can't understand, the charts, and I understand that part too. It can be a little confusing. Or if it's the consensus. So, it's tough because when you're in this position, I want to be responsive, but I also know that there's a lot of people who do like the dashboard and like going to it, on a daily basis and looking at what those updates say. So, that's been tough. Now, if it's a layout thing and you want to talk offline about, well, here's what I'd rather see with the layout, we're happy to hear that feedback. So, it's for you guys. It's not for me to go on there and entertain myself. So, if we need to make changes, that feedback and adjust from there. So we can hopefully talk more offline and get some more.
Sam, we can have a discussion offline. I'll give you a call sometime this afternoon, depending on what we get done here. If not, sometime tomorrow.
Could be a busy day. Tomorrow looks good, though.
Okay. It's a busy day here, so like I said, I don't know what time we're going to finish, but we need to have a conversation, I think, and at least I have more information to give, because I'm telling you, it's growing. It was just a few people, but now it's getting, as we go, it's becoming, and I'm sure Supervisor Stopper has the same issue.
Okay.
I did call Mr. Leach about it yesterday and brought up a lot of these. He addressed some of it in his initial thing. Thank you for bringing it up once again. I did want to follow you up on that if you're done, Mr.
Yeah,
Leach.
that's fine.
Talk now.
I haven't answered your Valley Springs testing
Yes.
Oh, yes.
Yes.
part yet, so I'll want to communicate that feedback back to my team that's responsible for execution and go back and talk about it with the team, and then we'll get back to you on that, okay?
Thank you.
To follow up, I mean, checking in with the team, with the vaccination clinics and everything, I mean, there's not much more you can do right now without having supply. But I also am concerned, we are the hotbed down there. There's legitimate sound reason behind that. I believe you've had testing at Calaveras Consolidated already a couple of times down there. So, it's not been consistent. I personally agree with Mr. Toffanelli. Consistency is a good thing if it's once a week, or maybe I think that at that point we will see a rise in the amount of people getting tested, because it will be readily available. We are, between the 95252 area has over 13,000 people in it. That's a major portion of Calaveras County. Shared between Mr. Toffanelli and I in our two districts. So I mean, at that point, if we're trying to aim to get people to do something, that's a good target for us to move towards, especially with it being closer to the urban center of San Joaquin County, where throughout this time, more often than not, when it's brought into the county, it's brought in through our districts because of the people that work down in the urban areas. It didn't start here, but it definitely came in through the western part of the county. To follow up on the dashboard, I was just looking at it, and I agree with Mr. Toffanelli. A few people that sent me emails, or the entire board emails, they have good points. My biggest thing is navigating. I go on there and I go for actual positive cases. And right now I just went on there and it says we were at 1,900 on February 3rd. It doesn't give a clear number when I swipe back and forth on, let's say, my iPad. So it's hard to see how that rises. But now you're saying total confirmed positive cases on your dashboard as of February 23rd today is 1,901. I know we've had more positive cases than just one. So is it rounding up and down? I don't think that number's clear when people are getting on the dashboard. I'm not seeing what our daily positivity rate is on the dashboard, said straightforward. Maybe I'm not navigating it properly, but it's hard to find. So while I agree it's easier for people to see daily updates, I'm on the same page as Mr. Toffanelli. Maybe we need to go back to something we were doing before. I think that's a larger discussion that maybe we can have off of line. If the rest of the board agrees, I would definitely like to be on that phone call with Mr. Toffanelli and you, to deal with that. This is our venue for active education of the public. So if everyone's not getting the message, we need to make some minor adjustments so that everyone gets the message. And let's see. Yeah, clinics in Valley Springs was on my list. You addressed that along with the testing. That about sums up everything I have to talk about. You already addressed what I called you yesterday about when it comes to, are we getting less than the next door county? I got quite a few calls from people that are saying, look, at Sonora, they're doing 800 people a day on the weekends. Their population is 10,000 more than us. Seems like they're getting more. and they continue to do that, and I understand that perception. So, I mean, it's something that we need to make sure that we also address. We have this information so that it can be found on the COVID page. I think there's some adjustments we'll have to talk to you and IT about. It's not you that's putting together the page, it's IT, so it's going to be a conglomeration of you working with IT to get them the proper information so it's relayed in a way that the community understands.
Yeah, it's a partnership of a lot of us, but I'm happy to lead that and get the feedback from you guys and then go execute. So just want to make sure the rest of the board is on board with that as well. So yeah, we'll go from there. Happy to hear your feedback and try to do what we can to improve things and make sure that the community hears what they need to hear.
And then there's one last thing I had on my list, but Supervisor Garamendi addressed it. All in all, pretty much the budget for public health is restricted money, generally doesn't touch our general fund, but at the same time, the board's ultimately responsible for how that money is applied, even if it is restricted and is only towards one use. So, just a note to Marcos, I would like a better understanding of how the public health budget in its entirety is being used in the future. A little more clarity. That's all I'm looking for. Not saying that anyone's been going one way or the other, but my interest is peaked now through COVID-19 when it comes to public health. So it's that's all. No need for an answer there. I think Marcos already addressed it with Supervisor Garamendi. Ms. Fullendorf, do you have anything?
Yes, I have two questions, or one comment, and a question. Going back to what Mr. Tofanelli has said about the dashboard, I too have been getting comments about it. And is there any way maybe to have a video walkthrough of how the dashboard works or something like that? Just to break, I guess put it in layman terms, what all these numbers and these grids mean for the public. It's just something that came to thought while they were discussing this. And then the other thing, I know you touched it earlier in your presentation, but could you go back over our tier system? Because the second biggest complaint I get is how do we get out of the purple tier? And I understand that it's data driven, but I think for the interest of the public to break it down a little bit more so they understand why these numbers matter when we're advocating for them to get tested.
Sure. The state's tier system has two measures that they look at, and we have to meet the tier in both measures to be reduced to that tier. So right now we're in tier 1, the most restrictive tier, the purple tier, because of two measures. The first is the case rate. So that's the rate of positive people who have COVID per 100,000. So for us, we're a county population of 45,000. So, you take that. I don't want to overcomplicate things. That's roughly 3.4 positive cases per day, 3.3, 3.4 off the top of my head. So because you multiply that, to be equivalent to what our population is. So it's per 100,000. That's the part that makes it confusing. And we need to be under 7 cases per 100,000 to get into the next tier, the next least restrictive tier. So that's where we're struggling because we're still over 7 cases per 100,000. So what that really looks like for us is it might be 4 or 5 new cases in our county. But when you factor that with, our county population is less than half of 100,000, that's why we don't meet that number. I hope that makes sense. It's really confusing. It's even confusing for the people who created this. I've been on a lot of state discussions where people are confused. And ultimately, you're just frustrated, and not you, Supervisor Fallendorf, but you being members of our public are just frustrated. They just want to know when we're going to get out. And why did the state create something that's this, complicated? It's just not very user-friendly. But that's one of the two, is how many people have COVID per 100,000. And when that number is above 7, we are in the most restrictive tier. And that's where we are right now. Now, on the other tier, it's the percentage of people who tested positive, right? So not the people who have COVID, but the percentage of people who've tested positive. And that one, we seem to be doing better. And frankly, I hope that the communications about making sure that we continue getting tested even when we're healthy has been helpful in getting that number where it needs to be. And we need to keep that number where it needs to be. So we need to keep doing it. We need to keep getting tested, encourage testing as much as we can, even for healthy people who may be asymptomatic spreaders. So that number has gotten better. That number needs to be below 8%. Now, again, this chart and the other tiers where we, right now we're just trying to get to the next tier down, right? We're just trying to get some room here. Help our businesses open up to an extent. But ultimately, we want to get in the least restrictive tier. And those numbers get harder and harder to achieve. So one step at a time. All of this stuff is on the Blueprint for a Safer Economy webpage at the state. So if somebody really wants to go tear into this a little bit more than the, snapshot back of the napkin analysis that I just gave you, it's on the Blueprint for a Safer Economy page that I mentioned earlier with the chart.
Thank you.
Clear as mud?
I believe that on the dashboard, there is a link to take you to that California website that explains the safer economy, opening of the safer economy. So if you just go to our website and that dashboard, up top of the page, up top on the left-hand side, there is a link that specifically says that. Instead of trying to go through write down quickly what you were saying what the website was, it's probably faster to just go to Calaveras website and in that dashboard and click that link on.
Yeah, thank you, Supervisor Tefnelli. That's true. It's so confusing. There's so much information out there. Even for myself, in preparation for this, I have, at least 4 or 5 websites that I'm going to, in the evening before, and then again in the morning. I've got to go somewhere else to look at how many doses were administered statewide. That's another webpage. It's really frustrating that it's not distilled better. I guess this is what happens when you have a federal, state, local, plus private, plus MCEs, plus third-party administrator, all trying to communicate at the same time.
Thank you, Sam.
Yeah, thank you, Sam. I just wanted that to just be repeated again for the public. So.
Gotcha. And it sounds pretty clear. I understand the direction from the board to look at what we're communicating and trying to distill some of the information that is needed in addition to having the data dashboard. I do get some, the tough part with feedback, I just want to say this, is that there is positive feedback on the dashboard, but people are less likely to send that. If people like the dashboard, they're less likely to reach out to you and say, I like the dashboard. But if they hate the dashboard, they're going to get a hold of it, right? So, I'd be hesitant to eliminate it. I like what's on the dashboard. I appreciate the work that's gone into it. I just think there are certain parts of it that I'm hearing the feedback, and frankly, I agree with some of it, that there are things that need to be communicated that need to be clearer, more distilled, and frankly easier to access for people who don't need to poke around to 3 or 4 different websites.
Yeah, I agree 100% with that. I mean, clearer, a little more precise. That's what we're looking for. I don't think we need to trash the whole thing. I think we just need to expand and take some input towards some positive ends. Also, I want to follow up on one other thing on, the tier system and how the state moves forward. And we have two hurdles. One is, positive testing to negative testing and what that percentage is on state. And then the other one is percentage per, or amount of positive cases per 100,000 people. Earlier in 2020, I'm going to say about July to August, I forget the exact word it was, but it was a type of appeal that your predecessor had used. They'd gone through the process twice. One of the times they were successful, and I believe it was towards the positive cases that were coming out of Avalon, and us getting the state to say, look, this isn't, total community based. This is isolated area. We won't move you backwards at this time because of what's going on in Avalon. Now, when we went to the regional state order or stay at home part, the state said no more of that. Everyone's closed down. So we're not going to accept these appeals at this time. I'm using the wrong terminology for this, but it's a type of appeal. Is that back? Do we have that opportunity in the future to possibly leverage the state to say, hey, look, our cases are down per 100,000, but we just aren't getting the tests in because people aren't sick. So we can't make that threshold on 7%. So, are we able to use that anymore? Oh, you're muted, sir. Sorry.
Sorry, yeah. I'm going to ask Colleen Rodriguez, who's on here, our Deputy Director of Public Health, to answer that since she was here back then and has the history as well as present.
Hi, Supervisor Stopper. I believe that you were talking about the adjudication process.
Yes, that's the word.
And that is no longer allowed by the state at this time.
Okay, thank you. At this time, if there's no other board questions, I'll give the opportunity for the public to call in. We'll give them a few minutes, or not a few minutes, but a allotted time just because of the delay. Thank you, Colleen, for that answer. Maybe we need to ask the state if they'll consider that once again, because things are fluid. Maybe in some of your meetings it can be brought up. Mr. Garamendi, I see your light's on.
Thank you very much. A question for Mr. Rodriguez. Thank you again for all the work you and your team at Public Health are doing. It's very much appreciated. Maybe you can explain a little bit. We all read the paper in the last couple of days, and it would appear that despite being in purple, we now have a special rule for football. Do you want to unpack why there are special rules, following up on Mr. Stopper's desire to appeal and get us out of this, which I agree with. Too bad that option's not open. But what is this? We're in purple, and football's not supposed to be played in purple, but now there's a special rule. I'm sure the public would like to know as well.
Sure. So, Supervisor Garamendi, the guidance for schools and school sports is constantly changing. One of the things that is changing are team sports. And recently, one of the allowances was that teams could play if they had, they were allowed to play if they were playing a county next to them. And so it was brought to our attention through our health officers that we have a region through Amador, Calaveras, and Tuolumne that those three counties play various sports, I think, with each other. And so we, through our health officer and the health officer of both Amador and Tuolumne, did submit something to the state to ask, because if sports aren't allowed with the 3 counties, then it creates kind of challenges for those sports to actually be able to play, because we are a region. And so, because if Amador can't play with Tuolumne, if they can only play with Calaveras, and they can't play with Tuolumne, then it defeats the whole purpose of the whole regional approach. And so a letter was written to the state regarding sports, and the last I heard, I believe that it was accepted from the state, but I have not received written confirmation of that thus far.
Well, thank you, Ms. Rodriguez. It is confusing. It's just another example of how we're getting mixed messages, but I appreciate public health taking a proactive approach and figuring out how to get these going, and I certainly appreciate all the vaccinations you've been giving our teachers and moving our schools closer to opening. I never thought I'd be grateful for having a 50% in and out program for school, but relative to other counties, it's pretty hard to complain. So I appreciate the efforts that you guys are making to try to open us up within the confines that we're given from the state. So thank you.
I would like to follow up on that, Ms. Rodriguez. We just said the state's not accepting the adjudication process, but here we write a letter to the state and they make a decision on a certain issue, which is not called the adjudication process, but it's the same type of process throughout it. It's like, look, here's the facts, here's how things apply, and here's why we think this would be a better way to go. The state's saying they're not taking an adjudication process, but they make adjustments to a letter. I do think it's a little bit more broad, the sports adjustment by the state, than just the 3-county area. They've opened it up more, supposedly, with certain restrictions. I've been reading up on it recently. But just food for thought when it comes to adjudication process. So we write a letter and ask them instead of calling it the adjudication process. Ms. Simpson, do we have any callers?
Yes, we do. Ms.
Oh.
McBride.
Okay, Ms. Terry McBride.
Ms. McBride?
Good morning. Good morning. Terry McBride, Calaveras County Committee Chair and Senator for New California State. So we're seeing, and I've been looking at the dashboard, I think it's okay, but I understand you guys' concerns. 1,901 confirmed cases, 37 active, 96.7 recovered, and sadly 25 passed, representing 1.3% of those confirmed. This is since March of 2020. That's 12 months. That's 12 months ago that we've had these numbers. And then you have to wonder how many people actually had it and didn't report it and are fully recovered, which is going to completely skew your numbers there, because I imagine it's really far less percentage-wise than what you're showing. If you go look at the CDC on their homepage, and I quote, "Seasonal influenza activity in the United States remains lower than usual for this time of the year." Well, could that be because medical facilities aren't paid thousands of extra dollars as they are for COVID? Follow the money. Because a lot of people that I have spoken to that tested positive for COVID, their symptoms were the flu. Almost precisely. A nasty flu, mind you, some of them, but the flu. California COVID's numbers have plummeted. Isn't that rather amazing? Since the inauguration. But it was never political, was it? From a high of almost 45,000 in California to just over 5,000. I'm looking at the CDC when I read these. In a state of over 40 million people. Look at the percentages. Dictator Newsom is facing a recall, of course. He's had his cronies in the legislature write a bill requiring mail-in votes, which is fraught with vote integrity concerns. If people are that angry at a dictatorial, pusillanimous governor, imagine how they feel about supervisors that have pushed the said governor's agenda along with public health. COVID, a means to control the people, take away their rights, destroy their livelihood and the economy, and some things you can do and can't do, like sports, but they're in control of what that would be. Interestingly, the definition of communism is control the people, take away their rights, destroy their livelihood and the economy, and decide what they can or cannot do, like sports. So in the end, where do you guys stand as our supervisors with this great country and our Constitution, remembering you took an oath, or are you with a communist agenda? You guys need to look at this open-minded, open-eyed, and stand your ground.
Ms. McBride?
Yes. Thank you. I'm done.
Okay, I just want to say, good to hear that you're healthy. We missed you the last couple of meetings.
Yeah, I needed a break.
Thank you.
Thank you.
Any further public comment, Ms. Simpson?
No other comments at this time.
Thank you very much. With that, if there's no other further comments or questions by the rest of the board, we'll move on to general public comment. I do want to say after we're done with general public comment, I'm going to have us take a 10-minute recess. So general public comment. Any item of interest to the public that is within the subject matter jurisdiction of the board and is not posted on the consent or regular agendas may be addressed during the public comment period. California law prohibits the board from taking action on any matter which is not posted on the agenda unless it is determined to be an emergency by the Board of Supervisors. If public comment is completed before the 30 minutes allotted time period, the board may immediately move to the next order of business. If public comment is not completed during the allotted time period, it will be continued as the last item of business in order to provide an opportunity for the remainder of comments to be heard. I assume Ms. McBride.
Yes. Ms. McBride?
Good morning again. Terry McBride, Committee Chair and Senator of New California State, Calaveras County, reading Grievance 44 for New California State. And as usual, we find that California has violated the United States Constitution, Article 4, Section 4, Article 6, the First Amendment, and the 14th Amendment. The order of the day is access denied to your government. Americans are witnessing the unfolding of two banana republics, one in Washington, D.C., the other in Sacramento, California, led by two emperors who have no clothes. Two kleptocratic saints are usurping naked and unashamed dictators that requires that every American citizen demand transparency and openness, yet it is not forthcoming. Neither is financial accountability or, for that matter, access to government that all generations of Americans and Californians have previously had a God-given right to enjoy. Access is denied to the citizens. However, access is granted to Big Pharma, the United Nations, Communist China, illegal foreign nationals, anyone else who is willing to grease the palms of the Newsom, Pelosi, Biden, and Harris mobs, as well as the highest bidders of any domain of human influence. Russian oligarchs are blushing with envy at the power grab that has been achieved by these un-American crooks and mobsters. We know how they rose to the top of the political structure, and we will remember the day justice is pronounced against them. The government in Washington, D.C. and the government in Sacramento, California have erected barriers to prevent citizens' access to government, all the while protesting their vehement disapproval of walls. Physical barriers now separate the United States citizens from government. That's our government that we pay for. And all this has been demonstratedly orchestrated by their Antifa agent provocateurs and foot soldiers, along with CNN support, who breached a Capitol building in full view of video and audio recording devices. The history books will take careful note of this fact. It is a matter of record. All this has been done at the same time the mono-party operatives of Newsom and Biden have been burning and looting American cities. This has not escaped our notice either. We also know they are colluding to designate us as terrorists for the crime of noticing what they are doing. As Shakespeare said, they will be hoisted by their own petard. Will this stand in New California? Not a chance. Justice is coming. We will not be governed by tyrants, even if they do have the protection of big media, big pharma, and communist China. In New California, we don't sleep with spies, and we don't betray our American republic. Justice will be served. We in New California are not right, left, white, black, or anything else. We are Americans. We are New Californians. Thank you, folks. Have a good day.
Thank you, Ms. McBride. Ms. Simpson.
No other further comments.
Okay, with that, we'll move on to a 10-minute break.
Anybody know what the part is?
A what? Consent agenda items are expected to be routine and non-controversial. They will be acted upon by the board at one time without discussion. Any board member, staff member, or interested party may request removal of an item from the consent agenda for later discussion. I'm going to first let you all know that Health and Human Services have pulled number 11 for a later date. So, I think we're fine with that. Would any board member like to pull an item for later discussion from the consent agenda? Any staff member? Member of the public? We'll give a few seconds for the members of the public.
I don't see any at this time.
All right. Well, with that, I'll entertain a motion.
So moved, Mr. Chair.
Thank you, Mr. Toffanelli. Everyone was pointing the other way to each other, so there's. Well, do we have a second?
Second.
Thank you, Mr. Garamendi. All those in favor?
Aye.
Any opposed? No? Passes on a 5-0 vote of the board. Excuse me. With that, we'll move on to the regular agenda. We'll start with item 30, Sheriff ID number 5886. Approve and authorize the board chair to execute JBCT agreement number 20-79014-000, a revenue generating contract between State of California Department of State Hospitals and County of Calaveras with a term of February 1st, 2021 through January 31st, 2024, for a revenue amount not to exceed $4,764,500. Approve and authorize the board chair to execute a professional services agreement with California Forensic Medical Group Incorporated with a term of February 1st, 2021 through January 31st, 2024 for a combined daily rate and one-time startup fees of $2,895,786. And 3, grant the sheriff and or under sheriff authority to execute future amendments and other administrative contract related documents within these contract terms and not to exceed amounts. With that, Mr. DiVasilio, is there anything you would like to say prior to the board?
Good morning again, Sheriff Stopper. Actually, I would have rather have been there in person. In case you guys had other questions, I wanted to bring my captain with me. I guess we could do this over Zoom.
So at this point, I guess I would just say I'll open it up to what questions you folks may have that I can answer.
Thank you, Mr. DeVasilio. Any questions by board members? Ms. Calloway, I see you reaching for your button.
I asked most of my questions to the sheriff prior to the meeting. Sheriff, it's my understanding, and when I looked at budget, you are looking to hire 2 officers and a captain position now. Is that my understanding?
Well, as far as the JBTC contract goes, the program requires 2 correctional officers, and so we were looking at 2 correctional officers and a correctional technician for the program. The captain's position is something altogether different, has nothing to do with the program in itself. That was something that I was requesting with the revenues that we would be receiving from the program.
Okay, thank you. I'm just looking at some of my questions to see if you make sure you answered them all. Oh, could you just address, because I wasn't clear, on the assessment for each patient that comes to you? Each IST that comes to you, I wasn't clear why
The assessment
your office had to do one, since I would assume that it should be done going to you?
The assessment is actually done by the medical staff for each person that is brought in to have their own assessment so that they know what their psychologists and or psychiatrists need to do for that particular person. It says that we'll do the assessment, but it's not the sheriff doing the assessment, it's actually the medical personnel.
I understood that. I just thought maybe the ISTs would come to you with an assessment already, and it just seemed like a duplication. That's
well, and I would imagine, and again, I'm not on that medical side of it, Ms. Calloway, but I would imagine that they do come with some sort of an assessment, but they're coming from a state facility into the JBTC program, and the medical staff that have to deal with those persons are going to do their assessment. It would be like you going to the doctors and then them recommending you go to another doctor. They're going to do their own assessment also. So I would imagine it's the same thing.
okay. So the only other thing I really had for open discussion here is on part 3 of the grant, where I said the sheriff or undersheriff has the authority to execute the amendments not on the not to exceed. That's pretty pro forma. Considering the large dollar amount, I thought we should add an approval of county council. I didn't hear from you or from council on that.
Go ahead, Sarah.
Yeah, I apologize, Supervisor Calloway. I should have responded to your email. So from my perspective, all services contracts get routed through my office. That includes contract amendments. So while if there is a subsequent amendment, this board action today delegates the authority for the sheriff or undersheriff to sign it and thereby not have it come back to the board. If it does not increase the not to exceed, it will still get routed through my office, through admin, and I will be signing, or someone on my staff will be signing off on it.
Okay, thank you. That's all. Thank you.
Thank you, Supervisor Calloway. Supervisor Garamendi.
Thank you, Mr. Chair. I'd like to start by thanking the sheriff for being innovative and coming up with ways to increase the revenue for this county using the resources that we already have. Sheriff, I appreciate how you approached this. It gave us a heads up a long time ago. You've answered a lot of questions. People like myself who've had questions over the time as we've seen this thing develop, and I'm pleased with it. So with not wanting to drag it out, when the chair's ready, I'm ready to make a motion.
Thank you, Supervisor Garamendi. I'll give the other board members the opportunity to ask questions if they have them for Mr. DeVasilio. Ms. Fullenborg.
I have one question, and it has to do with the extension of the contract after the years have expired. What is the likelihood that the state will continue with this contract, especially with hiring the additional employees that are suggested in the document?
Either I or Sarah can answer that question. The state is, as you well know, is not opening any other facilities for mental health services. They're actually shutting down some of the prisons where these people are being housed now. They assured us that the program will not be shut down. It's a 3-year contract at this point, but it will be ongoing. I know that Stanislaus County has their contract, and they have been ongoing. I don't see this ending unless we want to end it. Mental health, as you're very well aware, is a huge dilemma for our constituents within our counties and throughout the state of California. And they just don't have the opportunities to build more facilities. They've shut everything down, so they're utilizing the county jails to do the program. So, and again, Sarah can speak to that. She's talked to the DSH people also, but I do not see this program coming to an end unless we decide to end it.
I would tend to agree. I don't have a crystal ball, but based on the communications from the state to us, I tend to agree with the sheriff that I would be surprised if the state just decides not to continue with this program, with this partnership with us.
And Supervisor Pollendorf, just to answer your question directly, if for some reason the program did go away, we would be able to absorb the correctional officers and any personnel into whatever vacancies we had available at the time.
Thank you.
Anything, Mr. Toffenelli?
No, I met with the sheriff, and we discussed this item extensively, so all my questions have been answered.
Thank you. I just want to reiterate what Mr. Garamendi brought up. You know, it's a good thing bringing forward, you know, a revenue-generating project. Also, just one thing, and I already know the answer to this, Mr. DeVasilio. We've had open beds in the jail for quite some time. We're trying to make use of them. So this has no impact on the capacity of your capacity for, let's just say, inmates at any one time. Mr. DeVasilio? He's talking.
He's muted.
He's muted. Mr. DeVasilio?
I'm sorry, go ahead.
My apologies, I'll re-ask my question. The impact on the jail capacity is pretty much nothing, considering that we don't have the ability to fill all the beds in the jail at this time.
Correct. The facility is 160 beds. Our average daily population is only about 100. Very rarely do we go over that at this point in time, so we have plenty of room for these folks. And that was one of the reasons why I brought this and started working with the state on it.
Very good. Thank you, sir. With that, I believe we'll move on to public comment. We'll give them a short time to, based on delay.
is no public comment at this time.
Okay, thank you very much. Mr. Garamendi, we will entertain a motion.
So moved.
Thank you, Mr. Garamendi.
Second.
A second by Mr. Toffenelli. All those in favor?
Aye.
Any opposed? Passes on a 5-0 vote of the board. Thank you, Mr. DiBasilio, for the good work in bringing this forward to us.
Absolutely, and I just want the board to be aware, and Sarah can reiterate this, that this contract now will go back to the DSH for some more signatures. So it's still got a little bit more of a process the way the state does things, but this was just one of the steps prior to, and we're shooting for persons in beds April 1, just to give you a little bit of a timeline.
Okay. Persons in beds, not shooting at persons in beds.
Correct.
All right.
Thank you.
Thank you very much. All right. With that, we'll move on to item number 31. OES, receive a tree mortality program implementation update from TSS Consultants. Are we ready for this, or do we need a moment to prepare?
Good morning, Chair Stopper. I am ready to proceed if you are, sir.
Excellent. Thank you, sir.
Good morning, Mr. Chair again, and board members. We have a tree mortality update, and as is our normal practice, I'll introduce Chad Mason, our tree mortality project manager. Chad, are you on the line, sir?
I am. Can you hear me?
Yes, sir. Go ahead.
Excellent. Well, good morning, supervisors and members of the general public. We're pleased today to present our quarterly update on the tree mortality program. We've been conducting this program since Q4 2017, and we're pleased to report we've completed 33 projects, project to date. About 9,560 trees have been mitigated, and all of the projects have been completed with very minimal damage to private property. We've occasionally impacted a fence or minor damage to a driveway. All have been repaired, and the really good news is no worker injuries. As I think everyone in the room there and online can attest, tree removal services can be dangerous, and we're happy to report no injuries. Our outreach and communications to the public is conducted in 4 separate methodologies. Our first line of communication is directly with the property owner with the right of entry form that is granting us entry to remove those trees that might impact public right-of-way county roads. We also have a website that we update on a regular basis, monthly press releases, and then last but not least, our program manager email and phone number is available to the public, both on the website and through our monthly press releases. So we have regular interaction with a live body at the end of a phone line to take in any questions that might come up. Last bullet here on this particular slide, we are working closely with Director of County OES in the preparation of reimbursement requests to Cal OES, and so far all of the completed projects have been granted reimbursement. Good news. Next slide. Okay, these are the existing projects we have underway, 33, 34, 35. We'll start with project 35 up in Big Trees Village. Joe's Logging has the contract to remove about 400 trees, and we're 1/3 completed. However, due to snow load, we are currently on hold, expecting to restart this in early to mid March. Project 34, which is pretty wide ranging from West Point to McComey Hill to Sheep Ranch, Oneto Tree Service has this contract, just over 300 trees, and we're making good progress here. Weather has been a little bit of a holdup, but Brian Oneto is back at it now, and we should have this done by early next week. Last but not least, Project 33. This basically is that part of the county ranging from Blue Lake Springs to Angels Camp. Mowbray's Tree Service has been retained under contract to conduct this work to remove 245 trees. We had a pre-operations meeting yesterday, and today they are deployed in the form of 5 different crews dropping trees, and we're expecting to have this done probably by the end of March. This outfit, Mowbray's, is getting with the program, and we should be done soon. Next slide.
I'm sorry to interrupt you, Tad. Can I add just a little bit on 33, sir?
Oh, of course. Yes, please take it, John.
As Tad indicated, Mowbray's Tree Service is a new contractor for us, and one of the very unique features about Mowbray's is they have some very specific and specialized equipment, namely a harvester that has about a 40-foot boom and grabs a hold of a piece of the tree and cuts it off. So there's nobody climbing the tree, and the tree's not falling at its will to the ground. It's actually being placed by the operator on the ground, whether or not it's being taken out one section at a time or the whole tree. So we're very excited to see some what Tad and I lovingly refer to as exotic equipment out there in the forest. And I just wanted to share that Mowbray's has recently come on and won this contract. They're actually out of San Bernardino. And you need next slide. Thank you, Tad.
No, thank you, John, for mentioning that. I will, during our next quarter report, have some imagery of that equipment. It is European-based equipment that is typically deployed along power lines, and Mowbray's has decided to bring it in to the county for this project. So it could be entertaining. So tree mortality in the county, even though we've had some recent precipitation, it's still a relatively dry winter. And with that, we continue to see some mortality out across the county. We do anticipate that there will be a need for continued hazard tree removals along roadways, as evidenced by recent dieback and evidence of beetle attacks. We have been working with UC Davis to solicit their input and observations, and with that, we anticipate with their input, they're saying basically that we're going to see some more mountain pine beetle flights, if you will, probably April, May. And at that point, we'll likely deploy our foresters for another countywide survey to find out what the impact is. Next slide. These are just images of some of the dieback that we're seeing out in the woods, so along county roads. Next slide. So just to start to wrap up, this is my next to last slide. We do expect more mortality to be out there per our observations. Currently, we have deployed 3,249 right of entry forms to landowners, of which 952 have not been returned. We will continue to conduct outreach to those landowners as we perform our survey, and if there's still dead trees on those properties, we'll reach out to them again. Hopefully we'll get a better response on this next survey. Last slide, please, John. And this is the bottom line financials, project costs and reimbursements. This does not include projects 33, 34, and 35 because those are still in process. But bottom line, you can see the number of trees removed by time period. The state, CalOES, is providing 75% reimbursement plus 10% for administrative allowance, so 85% reimbursement, if you will. On top of that is California Department of Forestry, LATM reimbursement at 25%. So bottom line is the county is receiving significant reimbursement for the cost of this program. Looking at county expenditure project to date of $56,184, considering the number of trees that we have removed, the out-of-pocket cost to the county so far has been $5.88 per tree. So return on investment is pretty positive. And with that, I'll wrap up my comments. John, I know there's a lot of moving parts on this particular slide. Would you like to jump in?
Yes, sir. Thank you. Thank you, Chad, for the tree information. So what you see here in this slide is a tracking of each and every claim into CalOES and CAL FIRE through the Local Assistance Tree Mortality Reimbursement Program. We were initially provided with $679,196 through LATM, and you guys you Board of Supervisors moments ago approved with the consent calendar us engaging $68,508 more dollars through the LATM funding. What happened? The original LATM funds were available to 10 counties. Only 4 of them exhausted their funds. We were one of those 4. And they gathered up what was left and reallocated that to some counties that were still interested in utilizing the money. We were one of those counties, and we were awarded that $68,000 and some change. What you'll see here is throughout the cost of the program, we have about $4.7 million in total cost, which is substantial. So far this year, during this fiscal year, we have sought reimbursement and received $428,433. And actually, while we were waiting in queue to speak with you guys, I received word that we had received 2 checks for a total amount of $591,927 into our financial system. I coded it while we were at break, so it'll be entering the system here shortly. One of them was the December 21st DSR, and I believe that the other check, which was combined of a couple of them, it was about $425,000, and is I believe these 2 here. I haven't figured that out quite yet since it just showed up today. So the bottom line is this amount right here. We will be able to use the LATM funds back to the start of the fiscal year. So we will have, we'll be able to seek reimbursement for at least 3 claims that we've already claimed to CalOES. That will essentially exhaust that $68,000, but it will also, as you see here, essentially eliminate any cost to the county. And then, of course, this is the BLM grant that we operated last year that we sought and were awarded that has further reduced our costs. So as we make a claim to CAL FIRE for this new funding that you guys, that the supervisors just approved, that's going to drive our out-of-pocket debt costs down substantially. And with that, I'm happy to answer any questions.
Supervisor Derby.
Thank you very much, John and Chad. Whoa. But that reimbursement, that drives us almost to zero, if I read correctly. This is great, and I love this program, despite the fact that you've got a Neto working in my district. But yeah, let him know that, Tad. Brian's a good guy.
I will.
My question is, looking forward, will OES continue to fund this program? And obviously, by extension of that, will CAL FIRE reauthorize the LATM funds? And sort of what's the future hold? Can we keep this going?
Tad, would you like to address kind of from a industry standard point of view first?
Well, we have an excellent working relationship with CalWES, and in our correspondence and phone calls with CalWES, it appears that the state is planning to continue this TDAA-funded program at 85% reimbursement. On the CAL FIRE front, that's a little more up in the air, and we have not gotten any solid feedback from our contacts at CAL FIRE. John, back to you.
Thank you, Tad. First of all, I do need to correct myself, supervisors. The LATM grant is up for consideration in the next budget item, so you guys haven't quite approved that yet. And to be, from our outlook, the CDAA funding has held well through the last 3 years. And hopefully what will happen is they'll continue to see that not only is this taking care of the beetle issue, it is also directly reducing our fire loading in our forested areas. If you think about 10,000 logs, that's an awful lot of firewood that's not going to catch on fire during fire season. And as far as our county is concerned, if we lose LATM, that brings our cost to 15 cents on the dollar, which I think is fairly reasonable for the work that we're accomplishing. And as long as the CDAA, which is the California Disaster Assistance Act, funding continues as it has for the past 3 years, or going into 3 years, nearly over 3 years, we'll continue to operate and we'll continue to seek that reimbursement.
Thank you very much, and thank you for the report and update.
Very welcome, sir.
Thank you, Supervisor Garamendi. Is there any further board comments or questions? Okay, with that, I'll go to public comment.
There is no public comment at this time.
Thank you, Ms. Simpson. This is a update, nothing to vote on, so we'll move on to, if there's no further comments by the board members, I'll move on to item number 32. Oh yes, adopt a resolution to accept an award from the California Department of Forestry and Fire Protection, CAL FIRE, for eligible costs associated with tree mortality tree removal through the Local Assistance of Tree Mortality LATM grant program authorized by Senate Bill 108 in the amount of $68,508. We got a little pre-discussion in on that. So we'll start out with any board questions. None at this time. Is there anything Mr. Osborne would like to say?
None at this time, Chairman. Thank you for hearing the update, and thank you for hearing this item as well.
Thank you very much. So public comment?
There is no public comment at this time.
I'll entertain a motion.
So move.
Thank you,
Second.
Supervisor Garamendi.
Sorry.
Second by Supervisor Callaway. Thank you. All those in favor?
Aye.
Aye. Any opposed? Passes on a 5-0 vote of the board. Now we got the lion's share of the meeting, item number 33. I'm going to let you all know that I'm going to get this started, but we plan on taking a lunch break at noon. So with that, item 33, Administrative Office, received the year 2020-2021 mid-year budget, approved the mid-year budget adjustments included in attachments A and B, and 3, approved the mid-year budget capital assets list included as attachment C, requires a 4/5 affirmative vote of the board. Mr. Hall.
Thank you, Mr. Chair. Appreciate the opportunity. I'll be brief here. Deputy CAO Krista Von Lotta, as you can see, is unmuted and on the screen, and she has done all of the heavy lifting with preparing the mid-year budget report, so I'll turn it over to her to walk the board through with the detailed information. Krista?
Yep. Just, pardon me while I share my screen. All right, can everyone see my screen?
Yes.
Yes? Okay, great. Good morning, Mr. Chair, members of the board, Krista Von Lotta, Deputy CAO from the Administrative Office. Looking forward to sharing with you our summary of where we're at with respect to our budget as of December 31st of this past year. And so with that, generally speaking, we have, by way of recollection, reduced many revenue projections at the adoption of the final budget, consistent with what we believe are good conservative budgeting principles based on what we had seen to date at that point and the uncertainty related to COVID. Revenues are coming in strong, similar to the state. We'll get to that. Expenses are more or less consistent with prior years. Overall, our recommendation will be to stay the course at this time until we can get to budget development and give the board additional information with which to make decisions. Further to that, just as an overview or a general issue with respect to this conversation, to the extent that the board wishes to give us either now or at some point during that budget development or over the course of the next few months some policy direction as we move through this process, we certainly invite the board to do so and look forward to the board's comments. So in terms of how we're going to move through the presentation, a summary of expenditures as of this past December 31st, same for revenues, the overall mid-year summary, and then some board discussion and consideration. We also have additional requests that were not recommended by the Administrative Office and the memo, as well as one additional request from the Assessor's Office that is arising from an urgent need that manifested last week. Again, things we'll get to later in the discussion. So, in general, So in general, where we're at with respect to expenses is basically tracking the salaries and benefits with last year. Services up 1%, services and supplies up 3%, but not hugely material in the overall budget. We see a massive increase here in other charges, and this is as a result of the funds that are flowing into the general fund from the PG&E settlement account into the Butte Road recovery budget. That's up about 2.9 million. We'll see a corresponding transfer out there too. Capital assets are essentially flat. Transfers out are stable, and intra-fund transfers are down. But on the all-around, our expenses are up about 3%. So here we've got just a graphic depiction of where we are at as it relates to budgeted expenses for the year. So you can see services and supplies, we're at only 33% of what's budgeted. Same with salaries and employee benefits at 45.3%. What's important to note here when we look at salaries and benefits.
Krista, can Ms. Calloway's got her light on? She would like to ask a question while we're on this page.
Sure.
Krista, debt service, why is there all zeros in there?
You know, I apologize, Supervisor Calloway. I should have probably just taken that out because it is all zeros. While the county does have some debt service, so for example, HVAC, those funds are set aside and that debt is managed through a special revenue fund that does not hit the general fund, so it wouldn't be here in this presentation. If we were looking at debt service across all funds for the county, then that's where we would see, for example, the HVAC, the GO bonds, other of our debt that we know the county has incurred and continues to service.
Okay, thank you.
Thank you. Please proceed.
Pleasure. So this is just to give an idea of kind of where we're at in terms of budgeted appropriations. In terms of expenditures as they relate to last year, we're about $700,000 over where we were this time last year in terms of salaries and benefits. That figure was substantially higher the year before. We've still got the approximately 55% remaining. What's interesting about this is that when we balanced and recommended to the board the 5.3% cut, which equated to approximately $1.85 million in order to get the budget to balance in September, we did that reduction across the general fund contribution and the budget units that receive a general fund contribution for the most part. And we did it in the class of salaries and benefits. So this is, we are still trending, and we'll talk more about it in a few minutes, but towards some salary savings, despite the fact that we've already essentially removed the pre-budgeted, if you will, salary savings at the adoption of the budget back in September. So services and supplies, $9.4 million, about a third of the budget spent. It's a little bit more than $600,000 increase over the prior year, but basically tracking where we've been, except for years where there have been huge swings as it relates to disaster service or disaster recovery, etc. Salary savings, and so this is interesting. As of the end of the calendar year, we were on, there was approximately $1.6 million worth of salary savings that had been, that was in play at that time. So that's good in light of the fact that we did take that 5.3% cut out of salaries and benefits. However, and we see that it's down from what it was the same time the prior year, only by about $400,000. That said, it's actually trending down. And I wouldn't suggest that we would incur any more salary savings necessarily than what we see here at the outside. And quite frankly, I'm anticipating less than that, just by virtue of wanting to be conservative in terms of our projections, especially this year. And it is true that, for example, the patrol budget is not realizing any salary savings beyond what was the reduction that was made for the 5.3% back in September. So I don't think that we should expect to see the type of salary savings that we have in prior years. In terms of overtime costs, they are still continuing to come down. They were substantially less here than they were the prior year. They're less again this year. That is a good thing that the administrative office likes to see. We're hopeful that staffing levels will balance out at some point, although we are experiencing a lot of vacancies countywide. So budgeted REM loans and transfers, as I imagine most of you will recall, when we effected the REM loans at the close of last fiscal year, so as of last June 30th, when that happened, we incurred a liability against the general fund in the amount of the actual loans that were made. Loans were made to preserve cash flow, more or less, but at that time, as of June 30th of last year, what we were looking at was about a $900,000 loan, again hitting the general fund as a liability. As of this past December 31st, halfway through the year, and this is an additional number, there would additional $1.4 million has been expended out of the 3 disaster budgets where we are budgeting to borrow against the REM in order to pay those expenses until such time as we believe that we'll recognize revenues in the then current or coming budget year. So all told, we would be at about $2.3 million as of December 31st, if we were to, in fact, have been closing the books as of that date for this current fiscal year. We, the administrative office, the auditor controller's office, and Public Works and OES will be working together in order to shore up these numbers in terms of project closeout dates, revenue anticipation dates, and the ultimate overall exposure that the county might have in terms of having REM loans on the books. We have been advised by the Department of Public Works that they imagine there might be an overall $5.4 million of REM loans that are required in order to complete these projects. But I want to be very clear that working through the timing of when the projects will close and when we can reasonably anticipate that the revenue from the state and federal funding sources in order to repay those loans, so to speak, is a work in progress, and we are actively working with the affected departments so that we can bring you better information on that as we move through budget development. So in terms of revenues, we are coming in strong on revenues, but here's where I really want to caution the board and by way of reminder talk about when we made our revenue projection reductions at the time of budget development, and certainly they were included in the final budget. We did things like, and recommended to the board, and the board did approve, certain reductions such as we took 40% of the low estimate from the excise tax projections that we had received from the Division of Cannabis Control. Likewise, and when I say we, I mean the administrative office, the auditor controller, And in the case of, for example, the Division of Cannabis Control, affected departments and worked together to make what we thought were reasonable revenue projections given the uncertainty related to COVID that we were concerned with at that time. Somewhat like the state, anyone who might have heard the January governor's budget would have heard right out of the gate that while COVID has indeed created certain unforeseen manifestations or fiscal manifestations that we're dealing with, they weren't necessarily the ones that were anticipated. So things like sales tax, for example, where we made a 25% reduction, and the same with our dispensary excise tax based on the prior year budgets. We haven't actually seen those decreases. Likewise, we recommended a reduction of 50% in TOT, another decrease that we have not actually seen. In the same vein as sales tax, we have Prop 172 funds that are basically tracked with sales tax, all coming in strong, not just strong, but as it relates to, and this is where when you look at these numbers, 65%, you've got to keep in mind that some of these revenues were discounted heavily at the time that we made the budget or the budget was adopted in September. So so that is a good thing, but it's also there's still a lot of uncertainty, and we did not discount certain revenues like property taxes, which are our primary revenue driver. So the fact that that we have other revenues that are coming in strong is certainly good, but it's not as material as it could be to the overall revenue numbers. So was there anything on that slide that anyone wanted to go back to? I'll note here the operating transfers in are quite large. This is again because of the 2.9 million that is coming into the general fund and then flowing back out essentially to public works to do the work that's required for the Butte Road recovery projects. And this overall $31 million includes all of the transfers that either transfer to balance, the REM loans, the fire JPA loan was included in this number, although we're recommending to undo those budgeted loan, but I won't move forward since I'm not hearing questions. Right, so our revenues here are up quite a bit over this time last year. On the all-around, about 1 million more in taxes than this time last year. That is not including the excise tax, which is also up substantially, about $500,000 up in excise tax. In addition, about $600,000 in 887 revenue, and 2.9 million in PG&E. So that PG&E is really a pass-through and does kind of throw off the extent to which our revenues are actually up. That said, they are still actually up despite our revenue projections reductions. Our revenues still are in fact up by at least $2 million over this time last year. So overall, all funds, not just the general fund, were at about 48% in budgeted revenue, which is strong. Property taxes, so we did not, I will reiterate, we did not reduce the property tax projection for the adopted budget. It's coming in at 56.2% of budgeted revenue, and it is the lion's share of our tax revenue. Sales and use taxes are up from 1.95 million last year to 2.24 over the same period. And here's where you can see the effects of the 25% reduction and our projected budgeted revenue for that for the year, we're already we're already at 90.4% as of the end of December. So that's approximately 18% of the revenue that we've received. So Prop 72 was at a little over $1 million as of the end of December, at 75% of its budgeted revenue. And this is an example where we did make the reduction for the adopted budget. And same with transient occupancy tax, basically over budget as of the end of December. We did reduce this by, and this is, I apologize, this is a mistake. This was reduced by 50% for the adopted budget. In terms of excise tax revenue, we have a budget of $1.4 million, just a little higher than that. We've seen more than $250,000 from dispensaries as of the end of December, and upwards of $600,000 due to cultivation, for a total to date of $837,000, almost $38,000. Of note is that as of yesterday, we've received the just over the entire budgeted allocation for the year. So in terms of the overall summary, as we've discussed, the main areas impacting our mid-year position are the excise tax, and these, by the way, will more or less continue to affect us as we move through the coming budget cycle. Certainly excise tax is an area where we're looking closely and working with the Division of Cannabis Control to project where we think those revenues might come in. We certainly, budgets were affected, and if you've taken, have actually been able to go through the requested adjustments, there are budget units that were simply unable to absorb that 5% reduction, although it did not turn out to be a material issue for most budgets. Our increased revenue projections, and here again, I just really want to caution the board that just because we've seen these increased revenues so far to date, despite COVID, does not mean that we will continue to do so. There is still a lot of uncertainty over what's coming next. I don't know about all of you all, but I would certainly prefer to have a crystal ball on these days, but no such luck. So the good news is we are not expecting to have to make any of the teeter transfer to balance to close out the fiscal year at this point. Budgeted remnants and disaster budgets continue to be, will continue to be something that we need to monitor closely. We, when considering our general fund balance at the end of the year, have looked at these and have reduced our fund balance projection accordingly. And the CARES Act funds was incredibly material to our having a contingency that now sits at approximately $4 million, and has allowed us to both shore up the existing budget as well as help give the board some flexibility in terms of how to proceed as the county moves through this crisis, or pandemic, I should say. Estimated cash carry, after taking into consideration the things that I've just mentioned, we would put it somewhere between $2 and $3 million, and I do believe that that's quite conservative. Pardon me, but I wish to reiterate there is a lot of uncertainty in this market. On the good news front, we could see another allocation or additional funding, stimulus funding from the federal government, and if that is the case, then pending what the rules regarding using those funds and allowable uses are, that could be a very good thing for the county. That said, we still have an incredible amount of uncertainty in front of us as it relates to COVID. We know that we're going to be entering into MOU negotiations starting the end of the fourth quarter of this fiscal year, and we'll be having those conversations during budget development. There remain to be a lot of question marks, and we've talked about disaster budgets and REM. So all of these things still will be affecting our recommendations as we move forward. And so, with that, certainly any discussion and questions that the board would like to engage in at this point are welcome. And at the end of the day, thank you for receiving this report. We do have budget adjustments that are being recommended that are broken out by general fund and non-general fund, generally speaking, requests. We have requests that were received from the Sheriff's Department that were not included in our recommendations and are not recommended by the Administrative Office at this time, should the board wish to discuss them. And as I mentioned, we have one additional request that manifested last week from the Assessor's Office that would require no additional general fund contribution. It's merely to add an item to the capital asset list. So, were the board to direct to approve attachments A, B, and C, then and certainly to make any adjustments that they wish, please let me know how you would like to proceed.
Thank you. Any board members want to bring anything up now, or should we let the respective departments?
I have several questions, but I'm willing to wait till after lunch.
Right. We are on the verge of being at 12 o'clock, and I did say, I mean, we could leave, we can take a break and adjourn and then come back at 1 o'clock. I think it's a good time. Are we in agreement?
Yeah.
Back at 1 o'clock? Yeah. All right. So be it. We're live? Thank you very much, Ms. Simpson. We're back to the February 23rd board meeting. We're continuing on with, okay, gotta get caught up here. Item 33, Administrative Office, the 2021 or 2020-21 mid-year budget. At this point, we received the presentation. The board members, are we going to allow staff to come up with their propositions, or do we want to have any discussions prior to that? Oh, yes, ma'am. Looks like Mr. Macedo's ready. Or Under Sheriff Macedo.
Oh, either way is fine. Thank you, Chair Stopper. Jim Macedo from the Sheriff's Office. We're just here to follow up on the budget presentation by the County Administrative Office and conduct a brief overview of our budget and some outstanding matters that we're going to need to address with the board. So to give you an overview of the presentation, will be on page 2 of your packet, and for the public's record, we'll we'll provide an electronic copy to the board clerk, and I've also left a hard copy up here on the podium. We're going to talk about the MOU agreements with the unions just briefly and how those affected our budget during the first half of the fiscal year and what those impacts were and the effects of those impacts on the budget as we move through mid-year. We want to address the JB, that should be TC, revenue from the board packet that was presented to the board earlier today. We also need to note and excuse me for the acronyms, our RIMS cyber software. RIMS is our information management system that the Sheriff's Office utilizes to control all of our computer operating systems in both the jail and on the patrol side of the house, and also our 911 system. And Cybers is a incident-based reporting system, a national system that has been mandated, and I'll get into that in a little bit. We want to talk about some capital equipment issues, and then some of the positions that the sheriff requested that were not recommended by the county administrative office. So we're going to take a kind of a team approach to this. The sheriff's going to handle some of the issues. I will handle some of the issues, and as will Oscar as questions arise. Flipping to page 3 and starting with the MOU shift differentials. And I guess I have to ask, I want to make sure Ms. Von Lotta is on from the county administrative office because some of this will involve discussions that we had in the development of the budget overall, but in our discussions relating to mid-year, so hopefully she's available. As you know, there was negotiations between the unions and the county, and those costs were not included in the 2021 final budget and the personnel cost forecasting. So the Sheriff's Office had to absorb the costs relating to those shift differentials, those specialized team assignments, into our actual operating budget. The combined total, or the negative impact towards our operating budget based upon those union negotiated issues, across the board, was roughly $162,881. Mr. Flamenco broke that down for you further by budget unit. We had made some requests during final budget that we be reimbursed for those. The county administrative office has agreed to conduct a reimbursement only in the dispatch or communications budget, not some of our other budgets. And I just want to go over that and explain to the board how that impacts our department specifically. If you can flip over to the next page that states why MOU changes affect the Sheriff's Office differently. Those costs are spread out over multiple shifts and multiple departments within the Sheriff's Office. Obviously, we have a larger budget, so based upon percentages, there's a larger impact. You could certainly argue that since we're a larger department, we could absorb those. However, when you start to utilize an operating budget to absorb unanticipated union negotiated increases mid-stride or during the year, what happens is in successive years when the CAO comes back and asks for a status quo budget, that's artificial. It's not in fact a status quo budget because during that last budget year, those union increases had to be absorbed by the operating budget, so therefore they are no longer available for us to utilize. They are known costs that are personnel costs that are immediately removed from us at that time. So what happens is it basically builds an unhealthy budget year after year when you have the department absorbing those increases. Those increases were specifically pointed out to the last couple of CAOs, both your interim CAO, Mr. Lopez, and Mr. Lutz, and they found that unique. I had always thought that was bizarre and unhealthy, and they stopped that at that point in time because that was not consistent with other county operating processes where you have departmental budgets absorbing union increases. Normally, the county budgets for that and absorbs those outside of the departmental operating budget. More importantly, I think I would look at that as a departmental operating budget that's an emergency-based one, such as law enforcement and our 911 emergency system. So it also kind of provides you with the appearance that there are more available funds to the department than actually exist. So I wanted to make sure the board is aware of or reminded perhaps of those impacts on our organization, and we would still like to see the sheriff's office reimbursed. And the reason being is going to become more clearly as we proceed through this presentation. Bear with me a second while I get my pages in order. Okay. With respect to the JBCT revenue, we provided you with two separate slides. One, the first one you have just shows the operating costs for the remainder of this fiscal year. The second slide shows next year's fully operating costs, because we know the board often has questions about what the longer term impacts are going to be. The sheriff has some requests specifically relating to the revenue generated from the JBCT contract. They're position related, and I'm going to have him address those with you right now.
Good afternoon, supervisors. As you'll see there, the revenue, there's some costs there. There's 2 new correctional officers that we talked about for the program, and the correctional technician also for that program. Those costs are obviously going to be paid by the state. Those are positions that we have to have in order to run this program. The captain's position and the SST position. The captain's position is a brand new position. It's to replace the position that Under Sheriff Macedo vacated. I've talked to most of you about this position. The revenues that the JBTC contract is going to generate will more than well pay for these positions. The SST position, we have a young lady in there right now who has been working, she's an extra hire, so right now she's only part-time. I would like to and need to make her a full-time position because of the COVID that we've had going on. What happens is when one person goes out, typically 2 to 3 go out because of the contact tracing and whatnot. I know we're getting a handle on that, but this position needs to be brought into a full-time position. And I believe on one of the other pages it shows, well, here it is right here, it's $15,000 for to make her whole. To take her from a full-time position, fully weighted cost is about another $15,000. This contract is going to generate just over $500,000 a year. So to pick up the captain's position and the SST position out of that is a no-brainer. There's no cost to old general fund dollars. This is new general fund dollars. Now, in going through the CAO's packet, they've already spent my money that I worked very hard to get. I understand that it's general fund dollars. It's general fund revenue. But without that money, there's a lot of things that we would not be able to do, like do the captain's position and this other position for the sheriff's office. So if you want to go to the next page, these are the revenues. The contract's going to bring in, here it is, $578,488. Oh, we got a different one. There you go. You have the 2 new correctional officers and the new correctional technician. Again, they're a have-to-have. That's part of the program to make the program work. The captain's position and the SST's position. We've talked in the past about the backfilling the detective position that you guys gave me. There was a promotion because we had a gentleman go into the military for a year. I wanted to backfill the deputy's position, and we talked about that. That's part of the E-beat deputy to get our staffing levels up on patrol. And I also wanted to bring in another Met deputy so that we can do more search warrants during the marijuana season. I've scratched those off so that we can talk about that at another time, maybe when we start seeing some marijuana funding, tax dollars coming in. But these other positions, again, the 2 correctional officers, the correctional technician, are a have-to-have in order to run the program. And the captain and the SST are positions that I need back into the sheriff's office to help make us whole. So there's your total combined cost is $534,000. It's less than what the revenue is going to be. And I actually did a little bit of math, and on a year's basis, there's about $161,000 left out of that revenue, because you're already paying for the SST. She's just not full-time, so it's another $17,000 to make her full-time. So if you take the $258,000 for the sheriff or the captain, the extra $17,000 for the SST, that's $375,000. And if you subtract that from $578,000, it's actually more than $161,000. There's a couple $100,000 there. So there's other options out there, in my opinion. Obviously, the board has the final decision on what they do. You're going to see as we move along into this, we'll get into some other funding requests that I have for some vehicles. But these positions, obviously the top 2 I have to have, that's part of the contract to make the contract whole. The captain's position we've talked about in the past. Under Sheriff Macedo is only 1 guy and he's doing the work of 3. I need to give him some relief. And that Sheriff's Services Tech is a position, again, that we have a full part-time person. She's working 3/4 of the time, but I need to make her a full-time position. I'll let Jim talk about some more of the new revenues and costs.
If you could go to the page with RIMS Cybers, and I'm sorry, I thought we had page numbers on here. We'll get page numbers on our presentations in the future. So I mentioned earlier that RIMS is our Sheriff's County Information Management System. We're, as a law enforcement agency, we're required to report to the federal government Uniform Crime Reporting Stats, or UCRs. Those are major criminal stats such as homicide, rape, robbery. And there's an electronic system to which our records management uploads those crime stats. The federal government has changed that to a more robust system. And at some point in time, the Sheriff's Office will have to address the board because our workload as it relates to reporting in law enforcement, because there's been such a spotlight on us, has increased tenfold. And this is just another level of that. This Cybers requirement actually was mandated with an implementation date that had already passed. It was at the start of the new year. And it is a federally unfunded mandate that's been passed down to us. What has happened with this specific cost is at the final budget, we needed some bulletproof vests. In our discussions with the CAO wanted that deferred until mid-year. They gave us, well, actually, let me back up. The CAO gave us approval and agreed to allow us to purchase the bulletproof vests if we had salary savings at mid-year. That was a $25,000 cost. We chose to wait because we wanted to see where our salary savings was, because we were almost fully staffed at that time and hiring people, and we didn't want to spend money and be upside down at the end of the year. So we hung on to that and delayed the purchase of the bulletproof vests. What has happened at this point in mid-year is the CAO has recommended that we utilize the same amount of salary savings that we withheld for the bulletproof vests to purchase the cyber system. And you'll see with vehicles and some of the other things, our delays or our deferrals till mid-year are compounding. And unfortunately, the CAO doesn't understand that we have held on to funds to pay for projects towards the end of the year, and therefore they're seeing money in our budget. And basically, with the new OpenGov reporting system, they have control of our budget, and they're allowed to allocate towards certain areas. And this is an area where the money essentially has been double spent. So we need to maintain our position that we're going to purchase our bulletproof vests, which was provided by the board, but we need a general fund contribution to pay for this cyber reporting from the board. So that's some more cleanup that needs to happen. And I would caution the board in the future to a certain extent that when we defer purchases or we defer requests till mid-year, I understand there's only so much money available. There are consequences to that, and some of the consequences are there's an appearance that there's more funding available when the CAO reviews our budget, and therefore they want us to utilize existing salary savings for multiple purchases, and in reality there's only so much salary savings, and had we purchased them in the outright, it would have given the CAO a clearer picture of where we were at. However, there wouldn't be this funding available to utilize for the cybers system. Was that clear with everyone? I'm sorry.
No.
Okay. So let me step back. We asked for bulletproof vests. The CAO said, go ahead and purchase them. When we have to make expenses such as this out of some of our line items, we wait till the end of the year to make sure that we are going to have enough, that another emergency doesn't pop up or something else doesn't need to happen. So we waited. We are now at mid-year, and we were going to either make the purchases at mid-year or wait till the end of the year. However, the CAO recognized this pot of money in a line item and then saw our subsequent request for the cybers upgrade, the software upgrade, and wanted us to utilize the bulletproof vest funding for the cybers upgrade.
Okay, I understand that. But you said that the CAO's office recommended the bulletproof vest replacement to use salary savings. So that's where I got lost.
Sorry,
I mean, you've had salary savings, so could you use it in...
Yeah,
I understood that whole conversation, but the pickle was left off the plate.
What has happened, one of the new challenges that I think we are faced with OpenGov is it's an online budgeting system, and it deals with very raw data. It deals with numbers and line items, not unlike the paper stuff that you're familiar with, Supervisor Callaway, but it gives the appearance to someone that there is funding that is available for use, okay? And the appearance is given to those that aren't intimately familiar with the operating budget day to day, which is what we do. We manage the budget day to day. We obviously have expenses that are known and unknown that come in, and we manage those throughout the year. There's a cycle and a flow, and that's specifically what happened with the vest. We were provided with the authorization to make the purchase, but when Oscar and myself looked at it, we wanted to wait because there were some other unknown factors, and we waited, and then when the CAO took a look at our budget, they saw what they believed was available funding and went ahead and asked us to utilize that to pay for the cybers, when in reality they didn't understand that it was earmarked for the vests.
Okay, all right. Go.
Jim?
Yes.
What is the cost? I can't find the cost on here for the cyber.
The summary sheet will have everything. And Oscar will get it for you. What I'd like to do with the supervisor, just so there's clarity, and this is again a challenge with OpenGov. When the CAO builds the budget and places these funds into respective budget units, when we come to you like this with changes or after discussions with the CAO's office, we have to kind of open that box up and put things back where they belong, if that's approved. There's some things that the board's going to have to decide upon, but there's some things that after we've even discussed this with the CAO's office, they just didn't have an understanding of what was going on, And now after discussions and meeting with them, they do. So we're going to have to, I hate to use this term since it's being overused, we're going to have to unpack this a little bit and talk. In our summary sheet, I'm going to make specific line-by-line requests to brief the CAO so they can develop their opinion, which may or may not change, but also to brief the board. So our summary sheet, or our summary slide, will specifically outline what it is we're requesting and the amounts. Supervisor Toffenelli, is that okay? All right.
Krista? Are you there?
I am.
I just want to give a little more.
Yes.
Okay.
Just one moment, Oscar. Typically, when we do our budget, you know, we have appropriations, and we base the amount that we put in these different accounts or org keys based on what appropriations we're going into for the year, correct? So does OpenGov not show that, look, this appropriation has not been made?
So actually, OpenGov is rather transparent. So what it allows us to do is to budget as we've historically done at the class level, at the object code level, and at the sub-object code level. So that hasn't changed with OpenGov. Neither has departments' ability to use their discretion within certain rules that are set forth both by the County Budget Act and by our own budget and finance policy in the county. So for example, the administrative office may say, well, we think you guys have enough to make to cover the existing appropriations for bulletproof vests, or we recommend that you instead use those funds if that's your discretion for cybers. But neither one of those things would be precluded unless it were, for example, a capital asset and there wasn't already enough capital asset appropriation. So we do expect and hope to work with departments so that they do use their discretion in terms of how to use those appropriations that are set forth by the board.
To answer your question, Supervisor Toffenelli, the summary sheet that the CAO's office provided you guys, it's number 4 and the amount is on there.
Yeah, it was on the very back.
Yes, it was the very last page of the report.
So if I may, just as a general background from the administrative office, when we review mid-year requests, and I'll take, for example, the sheriff's PowerPoint indicates that AvTech funding, or funding for the amount of $51,300 was recommended for the dispatch budget, but not for others. And the reason for that is rather simple, and it's that when we look at the big picture, point about mid-year, we should be what might preclude a budget from being able to close the books at the end of the fiscal year. What material changes have occurred or are expected to occur that would make it not possible for us to close the books. So upon review of the various budget units within the Sheriff's Department, the dispatch budget was the tightest. And so while there had been 3 requests for additional funding, we knew that there was an issue with PERS unfunded liability. We knew that salary savings had been used to cover the AdTech remote radio, and we understand that the Sheriff's Department is requesting additional funding for shift differentials. It was clear that the dispatch budget would maybe not be able to absorb, be able to get to the finish line at the end of the fiscal year without additional funding. Such was not the case when we looked at the other budget units that are affected and that we've heard. For example, the patrol budget right now, and I do hear under Sheriff Macito's point when he states that certain purchases are put off until the end of the fiscal year to make sure that the appropriations are there. I do wish to remind the board that the patrol budget closed out the end of the last fiscal year with $740,000 of general fund appropriations that weren't used. Some of that would have been set aside for capital, but my point being, we do tie up lots of money in some of these larger budget units, and if we get to the point at mid-year where it's not clear that there's going to be an issue in order to close the books, then those simply aren't recommendations we would typically make. Pardon me.
I don't disagree with anything Ms. Von Lotta said. She was very much so on point. The only thing I would caution you is just because we ask for increase in appropriations, which are offset at times by revenue and maybe at times by not, at the end of the day, the board still sweeps the money at the end of the fiscal year irregardless. So you still have that authority. It still happened rather consistently. So nevertheless, the purchases need to be made, and I think when Ms. Von Lauder, the CEO's office, is looking at our budget, she's looking at it at a much more global level. And while the detail is a little more granular, she doesn't necessarily know our operating processes, nor can she predict problems that we're being briefed about that we're trying to hang on to funding. So I don't want to go to that level with the board, but I just want you to understand this isn't abnormal. I think this happens consistently in government. Ms. Von Lotta and I talked about probably increasing communications prior to building this year's budget because there were some communication issues that could have been caught. But nevertheless, what we're presenting with you today is, quite frankly, their needs and requests, and most of which are being offset by new revenue. But there's some other cleanup matters that need to happen.
I'll give just a moment, Ms. Callaway. I'll let you have the floor. The ongoing MOU changes is not just a issue at the Sheriff's Department. It's across the county. It's something that we need to start forecasting and planning for in our final budget. I mean, in the past that I've seen, I was going to bring this up later today, about new practices and part of our strategic plan that we're working on. So I mean, that all in all, I mean, that's something that we're going to have to program in the future. That way we know where we're going to be at and we don't have to go through this. Mid-year budget, yes, there are adjustments in a lot of other places, but commonly it's far too often become a place for people to come in and do more asks in Calaveras County for quite some time. And there's always unforeseen issues that come up that cost more. But with that, I do want to continue conversation, and Ms. Cowboy's had her light on for a little while.
Oh,
so I'll give her the moment.
Right. No, go ahead, Mr. Stopper.
For the moment.
So shall I bring the sheriff up for the capital portion, or did you want to take questions from the previous
No, I
pages?
guess you brought up the rolling to the general fund. That's a county position, because does it roll or does it stay? We've had that conversation for years.
This week?
This week.
Yeah, okay.
So, I mean, that's not new. And at one point, the general fund used to pick up the MOUs for all departments, because Mr. Stopper's right. You're mentioning it's the same for every single work unit besides the sheriff's office. I guess what I'm not clear on is why you waited. If you had an allocation or for the vests or for the rims, so why wait? I mean, if it's allocated,
sure,
then you should get that. I mean, go ahead.
So with a lot of our purchases, there's sometimes we get something and boom, I mean, we order it the day after we leave here. But with some of the approvals, depending upon the budget unit, depending upon what's going on in that particular unit, depending upon what news we've received at times since we've submitted the budget to the CAO and us actually getting before you, things change. Our budget based upon criminal activity, facilities repairs, weather, staffing shortages, so it's constantly moving. And so that's why I don't blame the CAO for not being able to track that. But when we have budget meetings or we have discussions specific to the vests, we were looking at a couple of different vendors, and if you recall, we also write a grant that reimburses us for part of that. So there is some timing associated with receiving those vests. But specifically, we were looking at that equipment line, and that equipment line was getting hit a lot this particular year, and that's why we wanted to wait a little bit further down the road to see where we were at.
So because, oh, I'm sorry.
No, forgive me, Supervisor Callaway,
Oh,
please.
Go on, Ms. Monlott.
Ms. Vaughn, go ahead.
Oh, I just wanted to clarify for the board that MOU increases and other salary progression are incorporated on an annual basis into our budget. It's part of our workforce planning. And so those changes are included. There is a difference with respect to the Sheriff's Department shift differentials. Those are not included. And to the extent that we are negotiating, then we will bring separate dollars projections to the board in terms of what those MOU increases would mean. But I just wanted to clarify that we do actually update annually when we enter in the budget process for the prior, for what's currently and expected to happen in the following fiscal year.
Thank you.
The next, go ahead, next one there.
Capital.
There, capital. I'm going to kind of switch things around, but I want to start at the bottom. We have a vehicle that was, one of our deputies was in a head-on collision, and we're still waiting for the insurance company to reimburse us for the cost of that vehicle. As you can see, the vehicle is $82,000. So what I'm asking the board to do is front that money because the insurance company is going to pay it. It's just we're still waiting for them to finish their processes to get that done. There is another vehicle is that other vehicle on here?
No, that one is not, because the CEO recommended supporting the one that was our fault. This is the other party's fault.
Right,
So there's
yeah.
a bigger outlay of capital.
Okay. Okay, but yeah, so again, this is a reimbursement to the general fund by the insurance company.
Of $82,000?
Yes, ma'am. Yes. So jump back up. We have the two Ford pickups. One of them would be for our off-highway vehicle program. The other one would be for our boating and waterways program. As you guys well know, the state has bought us a boat, and I know we're working on trying to get another boat right now. They do not supply vehicles to tow these boats. And I know, I can hear it in the back of your minds right now. You're thinking that we bought a boat, trailer, or a truck last year. Well, we have two deputies that are running boats with one truck that doesn't work very well. I need another truck. The truck that we're utilizing right now is a 2006. It's got a ton of miles on it, and it's consistently breaking down. So this would give us a new vehicle that would last for 10 to 15 years. With the amount of miles they put on them, it'll be a diesel truck that's going to last a long time. Same thing with the off-highway vehicle program. There's kind of a catch-22 at the OHV program because the state's not giving us a lot of money for that program anymore. So the deputy that works the OHV program is there for 4 months, and then he works out at Hogan for the remainder of the 8 months. The benefit of getting this truck now is that not only will he be able to use it for the OHV program, but we have extra boats because we purchased a new boat last year. He's able to work out on Hogan on a boat. So it's twofold. It keeps our public safe when they're on our waterways, and it gives them the ability to tow that boat around to get to the lakes. What this will do is, if you think about it, we have Maloney's, you have Tulloch, you have Hogan, and you have Comanche. Well, we have 4 lakes with basically 3 guys right now, but now I only have 1 truck. So this will give us 3 guys with 3 trucks, so we can cover our lakes. That's going to bring our accidents and whatnot. I brought that to you folks at the last board meeting, showed you the accidents that we've had, and if you've noticed that on Hogan and Comanche, where we're running deputies more often, the accident numbers are coming down because we're out there. If we do the same thing on Hogan, it'll bring those accident numbers down.
Right.
And that's the goal.
One question, we're also patrolling Tolek, and you've seen a substantial decrease in accidents on Tolek.
Yes.
You and I discussed this prior. We've seen accidents go up substantially on Hogan. Now, I don't want you to stop patrolling Tolek. I think that's, with how crowded that lake gets, it's very important for the safety of the people. But Tridam does not pay you any money to patrol that lake.
No.
At the same time, the Army Corps of Engineers is giving you money for Lake Hogan. And we're falling off on Lake Hogan in the stead of, and I like I said, I'm not trying to say anything against patrolling Lake Tolek. I'm for that because you've been successful at it. You're showing success at it. We're saving people from injuries and lives.
Yeah.
But I think there's an imbalance there when it comes to Lake Hogan not getting the patrols that it needs, and it's showing in the numbers. And we're receiving revenue for that.
Correct, and it is working, and I've been working with Supervisor Fallendorf, and I worked with past Supervisor Mills on getting Tridam to start giving the county some money for those. So that's another conversation for another time, but know that we are working on that also.
Right, no, it was the time to bring it up because you're trying to control more lakes.
Right.
All right, I'll let you continue.
Okay, so again, I go back to my JBTC revenues. I know that the CAO's office has pulled a lot of that money and put it into different areas because it is general fund money, and I don't discard that. But one of the deals that I made with some of the board members that are still here was that you guys buy marked patrol vehicles and I will buy unmarked patrol vehicles. These are marked patrol vehicles, so I believe that the general fund should be purchasing them. However, because of the cost of these two vehicles, they're expensive. They're $107,000 to be purchased and completely outfitted so that they are marked patrol vehicles. I would like the general fund to pay for one of them, and I would pay for the other. And I hate to use this term, but I know Mr. Toffanelli loves to hear me say this. I would be willing to pay for the other vehicle out of my AB 443 funds.
Yes!
So, that's a win for everybody.
It was a long conversation yesterday.
It is. But it's a benefit to the county as a whole to be able to purchase both of these vehicles prior to our season starting. Because these aren't vehicles that have to be built. I can go to a dealership and get them dialed in and probably have them up and running within a month and a half to 2 months, so that they can be out doing what they need to be doing, which is pulling these boats and whatnot. Now, there is, again, like I told you before, revenue from the JBTC contract. We can use that funding for this one-time purchase. There are funding options out there as opposed to dipping into the general fund. You now have new money coming in. You can counter that back and use it out of JBTC. So I'm giving you options.
No, and I'm hearing you. So that would substantially change the $296,000 you got for vehicle purchases by less of $107,000.
Right. Well, you remember
if this is the road we end up going down.
Right, and you got to remember that $82,000 is going to be reimbursed by the insurance company. We're just waiting for them to finish their paperwork side of it. So that money is a wash. That's 82 that we're going to spend, but we know we're going to get that 82 back because it's from an insurance company for a vehicle that they wrecked. These other two, this $114,000 or $214,000 is brand new vehicles, and again, only half of that. The 107 I will pay out of AB 443, so I'm only really requesting 107 from either general fund or if you want to use the JBTC money, which there's plenty of to do that, even with my captain's position and that sheriff services tech. You know me, I'm a wheeler and dealer. Let's talk.
I know you are. You're trying to buy some more love here, Rick.
You bet I am. But it benefits your constituents.
It benefits us all.
Absolutely.
I wish we had enough for everything. But that being said, we're going back to the JBCT new net revenue. The first page you have here, you have $142,641. That's for the remainder of the year. So that's I get it on a year-to-year basis that it's going to be $578,000, $488, or a little over $578,000. But you sit here and you're trying to say that we could take some of that out for one of the trucks, but at the same time, we're still in the same fiscal year of the 142.
I know.
So it's not going to pencil out for any of these other positions that we're discussing right now also. So you can't really offer that, and then unless you're willing to give those, and then we'd have to go to general fund for these.
I understand that.
It's a give and take.
I understand that the money's going to come back in is what I'm getting. It's almost like the $82,000. That money is going to come back in through the contract.
Right.
It's you're going to pay it up front. There's no way to get around that. Now, because we don't do leases anymore. We don't want to do leases. I've already talked to the CAO's office, and that's a pain. But the money's there. So, again, you're looking at $107,000 out of general fund dollars. Where you want to pull that from is up to you. I'm just saying there's an option. It's the
Right.
money can come back.
Right.
That's all.
No, I understand. I understand.
And it's the same thing with the captain's position and that correction, or the sheriff services tech's position. You got to remember, if you do give me that captain's position and that sheriff services tech position, those positions will not start until the pay period after we start putting people in beds. Because we get paid for all 10 beds, whether there's one person in there or there's 10 people in there. So those costs will be covered because the cost of the personnel will be paid for on a month-to-month basis by the state.
Okay. Do we want to go on to other new positions?
That was all I had.
You done with capital?
Yes.
All right. So there's one other page I see down here that...
That was already addressed earlier.
That was already been addressed.
At this point, we're ready to summarize, and I can give the board some hard numbers that you can pencil out to help you make your decision, or ask further questions if you're ready.
Go ahead, Gary.
Yeah, I have a question. What is CalEMA? That budget item?
CalEMA is an old term for California Emergency Management Administration, and at one point in time, they had funded a grant that paid for a position, and the title was utilized by the auditor's office for marking, and it is stuck forever. But basically, that doesn't exist, but there's a position. There used to be.
There's $127,000 in that.
Yeah, it's funding a position.
You can't utilize that funds for a position other than this?
No, and can you reference what you're looking at so I can make sure we're talking about the same?
I'm looking at key 101-00351, CalEMA operations. And I'm looking at, it's a SRF fund, transferred from SRF, $127,040, and it has been untouched. It's this whole year, $0 have been used out of that fund.
Perhaps somebody can bring that up so I can make sure we're talking about the same.
101-00351.
I don't know if the clerk has access to that, Supervisor Tom.
Okay.
Can I approach maybe and look and see what you're looking at?
Yeah, sure.
What page on the packet is it?
It's not in the packet. I have his budget. I have the sheriff's complete budget.
Sheriff, I'm not clear on, you've crossed out the Met and the detective.
The backfill, correct. Those were positions.
And then, but you put them in on the back summary. Are they in or are they out?
Oh, no, they're out. They're out.
So
The
on
Met
the
position-
closing, in the closing priorities, the Met position and the detective backfill are out.
Are out, yes, ma'am.
Okay.
Rainy day fund?
Answer to you, no, I wish it was. So to answer your question, that is that existing grant that was housed in our, at one point in time, CalEMA was funded, and it was a different name for CalMet, which was a methamphetamine enforcement grant, and it funded one single position, full-time weighted. That is an existing position that's in our investigations unit that has not been filled because we've been filling other patrol staff positions.
So that would be considered salary savings at
It
this
is. It
point?
is not an equipment operating budget. It is a salaried position that exists in our narcotics unit.
Yes, it's a special revenue fund.
Correct.
It's special revenue fund, if we had a position, would bring in funding to the operating budget.
Okay, so this is grant money?
It's not anymore.
It's not anymore, so it could be considered salary savings for the year because you haven't utilized any of it so far at all. And I don't think last year, looking at last year's budget, you utilized it either. So it's been carried over. So that funding,
Could you hear what Oscar said?
no.
It wasn't utilized, so it's been increased. So I would have to look at the historical amount in there,
Okay.
Supervisor Toffanelli. I don't want to leave the board or you with the impression that we receive that much every single year. That could be a compounding of us not having the ability to fill that position over multiple years because of staffing shortages on patrol.
If you can get back to me on it, Oscar, Jim, let me know, because it's $127,000 right here.
It does appear that there's about $766,000 on contingencies in that fund. And there's been $100,000 of revenue so far this year in the special revenue fund.
Without being able to look at that, I don't know what.
How much?
That's
$766,000.
Hey, Krista, can you tell me what it is you're talking about?
It's 58100082.
58.
The special revenue fund for CalEMA with the budgeted transfer out of 127. It looks like the fund balance is about 766,000 and about 100,000 of revenue so far this year.
Can you give me that number again? You spoke way too fast.
Yeah.
Sorry, Jim. Sorry, Undersheriff.
580.
58100082.
Okay. I will double check. I don't think we have a budget unit with 766,000 sitting around collecting revenue without some sort of outlay or expense associated with that. So let me get back to you. I don't like how that sounds, quite frankly, and I think there's something wrong. There's some inaccuracy going on, or somebody is looking at something and not fully understanding what type of expenses are going towards that.
If you could get back to me.
Okay.
Okay. I think we're all curious on that.
Get back to all of us and let us all know. Yeah.
Okay, are you ready to summarize? I'll take that as a yes. So, in order to offset the MOU increases, the sheriff's office, and I guess let me step back and say we need the board to take action on each one of these, if they would, individually. That'll help clarify communication with the CAO's office as we move forward, because sometimes it's difficult for us to track what the board agreed to on a point-by-point basis. Afterward, there's sometimes some confusion, or one person from the sheriff's office heard it one way and the CAO's office heard it another way. So we're at...
With that, Mr. Macedo, I'm going to recommend that we hear your summary on this.
Yep.
But if there's other things that are coming to a head with our mid-year budget, I recommend that we go in the fashion that you're saying at the end of this item, so that we can, picture the whole county on when we make these decisions. Because I don't, I think that's the best way to proceed.
Absolutely. I hear you loud and clear that we're a small part of an overall budget. I just, when you guys vote, if you could, and these were in order, the order of preference with the sheriff and sheriff staff that we discussed. So the first item would be to offset the MOU increases for a total of $162,881. And again, that's to prevent us from going into multiple budget years while continuing to offset MOU increases. So it's that whole unhealthy budget appearance issue. Number two is the second item was the correctional tech position, which, and actually let me back up. The MOU increases, we're requesting general fund dollars. Correctional tech is offset by JBTC funding, so that is not a general fund impact.
Should have those two correctional officers in there too for the JBTC program.
I think that's because the board agreed to that already, and it's not an additional outlay.
The CEO
recommended. Yeah,
Oh,
it's included in CIGA recommended. The new captain, again, $69,500. That's offset by JBTC funding, CT funding, excuse me. The $25,000 RIM Cybers, that's a general fund request. The vehicle purchases, I believe if I heard everyone right, we're down to 189, and that's a general fund request.
With 80 some odd thousand being reimbursed later after the
Correct, the 82,000.
Right. And then, okay.
To be more specific, on the two vehicles, one is a general fund request for $107,000 for either the Met or the Marine Safety Truck, and the other will be $107,000 for AB 443.
Right. So we need to approve that either way, correct? Right.
Next in line is the Sheriff Services Tech position for $17,000. The sheriff agreed to offset that by JBTC funding, and he has eliminated the other requests. So my total general fund request at this point is $376,881, $376,881. The remainder of the request totals, the remainder is JBTC. I can't get that one out. JBTC request, and I'll have to run a new total for you on that.
Mr. Chair?
Yes, ma'am.
I have some questions. Under Sheriff Macedo, the correctional tech for 14-3,
yes,
that's the one that comes with the two correctional officers?
Correct.
Okay. So do we need to add in the two correctional officers?
That's a good question. That's what the sheriff was talking about. We aren't discussing that because the CAO did recommend that.
Okay.
That is an area where you're in agreement on, so we're not bothering
Okay.
the board with that.
Krista?
Supervisor Callaway?
On the new correctional tech and the new captain, your office did not recommend it at this time. Could you please tell us why?
Sure. So, in general, given that the JBCT contract is a jail contract, the nexus from the position of this office is that those funds should stay within the jail budget. While we're not necessarily recommending that, for example, those funds be used to backfill facilities issues in perpetuity, That would be an example of where we know that there's exposure in the jail budget going forward. We have recommended the correctional tax. While I fully expect that this contract will go well over the course of the next few years, it is still in its infancy. We've yet to fill a bed. And that is something that will happen over the course we expect of the next month or two. That said, if for any reason the census under the contract were to go down to less than 10 beds on average over any 3-month period or on a quarterly basis during the contract, then the revenues would then also decrease per contract amendment. So while it's great to be looking forward to this potential revenue, the position of the administrative office is that we keep those revenues inside the jail budget. We use them directly for such things as correctional officers to service the contract and the inmates. And at this point, we think it's premature to be budgeting on what is essentially one-time funds. I understand it's a 3-year contract, but with permanent positions across numerous Sheriff's Department budget units at this time.
Okay, thank you. When would the first check come in for JBTC funding? I can't remember the contract. Is it in April, or is it the setup comes in March?
The way it's set up is that the first, they'll be putting people in the beds April 1st. So the billing would start directly after that.
Okay.
The billing would start, but is it a monthly?
You know, it's the state. I'm not. I can't honestly tell you. That would be a question for the state.
This is another case where we're talking about revenue that's not in our hand yet that could possibly fluctuate depending on how many people the state has in beds.
Well,
it doesn't.
I'm sorry.
It starts out that the minute they give us one person, they're paying for 10 beds. Ms. Von Lotta made a very valid point, though, that at every quarter, if it drops down, they're going to adjust it. And again, the state has assured, and she was there, as was Sarah Edwards, that they do not see that happening because they have no place to put them. And since the inception of us starting this program to get it up and running, they've added almost another 200 to 300 people to the program. So they still need the beds. So you got to understand it here. I told you folks that if for some reason this contract went away or if we weren't getting the funding, I would take those positions back. And I still stand by that. That's how confident I am that this program is going to go. And we're not going to have an issue. So you have a guarantee. We can always bump people back and always have a vacant position. We always have vacancies. So it's not like you're taking a chance on anything. I'm very confident this program is going to work. The issue that I had with the way that the CAO built this money out is they took and put $121,000 of JBTC money into the facilities, and we never requested that. They just arbitrarily took $121,000 and put it into the facilities repairs. But the money will be there. And again, if it's not, we'll pull those positions back.
No, thank you for the clarification.
I have a question, Mr. Chair.
Yeah, Mr. Toppinell.
Yeah, your projected amount of money that for the remainder of the year on this contract is $142,000.
I'm sorry, say again.
Your projected revenue income for the remainder of this year, starting April 1st with this contract, is $142,000.
I believe so, yes.
That's what you had up there, and it's in the packet. The recommendation, so the numbers aren't making up here to me, because the recommendation from the CAO is $43,000. And then they're going to use $120-something thousand of it into the facilities.
No.
No.
That's again.
See, I need to clarify what's
The CAO arbitrarily on their own chose to take JBTC money and put it in a facilities line item budget without discussing that with anybody at the sheriff's office until it was presented to the board.
correct, but the 122 they want to take and put in there plus the 43 is 165 versus 142. I'm just saying the numbers aren't jiving.
If I may.
Yes.
Okay, so the numbers that were proposed to us by the Sheriff's Department to the administrative office are for a total of this current fiscal year of JBCT funding for $571,500. So all of it has been budgeted, recommended to be budgeted, I should say, in the sheriff's jail budget. The facilities budget reference that we're hearing is to the line item inside that budget for facilities maintenance. This being like many of the other appropriations in any particular budget unit, they could be moved off of that line and spent on other things so long as the other items, for example, wouldn't be capital, which would require board approval. Regardless, we did keep 100% of that money in that budget unit, and the recommendation does in fact include that $122,000 of it be set aside for facilities maintenance, strictly because we're well advised that there are potential issues coming up quickly related to the jail infrastructure. That said, that is within the board's purview. I just wanted to clarify that we're talking about $570,000, all of which at this point has been recommended to stay within the jail budget.
But that's not what I'm hearing. If that you're utilizing that money in this current budget, when I'm seeing what the sheriff is showing up here, that we're only going to get $142,000 in the current budget year from April to June 30th, not $575,000.
So that's new information if that's what the sheriff's department is putting forth that's not consistent with the information, the requests that were made of us by the sheriff's department before today.
That's unallocated revenue. And what's happening, Supervisor Toffanelli, is you're reviewing a budget that was built by the county administrative office, not the budget that was built by the sheriff's office. And if that sounds familiar...
Not what's happening.
Okay. Well, I disagree. I disagree.
Do you understand what I'm saying here?
Yeah.
You understand what I'm saying here? The projections that apparently are being projected here by the CAO's budget is going to have a deficit of about $400,000 because you're not going to get $575,000 this year out of this contract because you're only going to get April, May, June.
That is the graduated amount, and if you'd like me to share my screen and show you the budget transfer that was submitted to us by the Sheriff's Department, I'm happy to do so. It clearly indicates $571,500 of new revenue for the remainder of this fiscal year with related funding requests.
Well, I certainly think that we need to have this straightened out if we're not going to utilize or we're not going to receive that amount of money and we've put it into a budget this board's being asked to approve, because somewhere we're going to have a huge deficit here that's not going to be something we can cover by just writing a check for out of contingencies. Because there's some other issues coming up that we have not even got into in other areas of this budget.
So the Sheriff's Office submitted a budget, both in writing with a budget narrative, and it was entered into OpenGov. The CO's office made some changes. We spoke with them over the phone, and tried to work through some of those changes so that there would not be this level of confusion with the board today. When we developed this PowerPoint, we also did that in an attempt to clear up some confusion because there are disagreements. Those disagreements largely surround JBTC revenue and some additional general fund revenue requests. That was what the PowerPoint was built based upon. I don't know how to make this any more clear. What you saw was not exactly what we entered, nor was it what we requested with the JBTC revenue. We requested positions that were not recommended by the CAO. Therefore, you did not see those, or if you did, I wasn't briefed, but that's why we put the presentation before you today to be specific about what our general fund revenue request was, and separately from the JBTC request. After last year, Supervisor Toffanelli, we endeavored to make this a lot less confusing to the board and more clear so that it was an easier decision. But at this point, I cannot control the actions of the CAO's office and how they enter stuff into OpenGov. The only thing I did was make a request to be there when they're entering this into OpenGov so that I not only have an understanding of what they're entering, but what the potential conflicts are early. Separate from that, you guys have all heard from the sheriff as to what his requests are for the operating budget for the year.
I have a question for Rick or Jim. I'm not sure who wants this. Going back to the OHV vehicle, and this is just curiosity, how do the grant funding at the state, can that help supplement? Or, I know you want it for this season, I hear that, and I know grant processes are months long, but is there a way to have the OHV fitted, I know it's by the grant funding that the state provides for these programs? Or is it because it's outfitted as a patrol, it doesn't qualify?
No, the only thing they're giving us is funding now for personnel. They're not giving us any funding for any equipment. That's the whole problem.
Okay,
But the
got it.
benefit is that we're collecting some revenue through Hogan for 8 months out of the year, so that'll help. That also pays for the employee. It doesn't pay for any equipment costs. We're just, as a county, kind of biting the bullet and getting the boats through state boating and waterways, so the county's not having to buy them, but we have no way to tow those vehicles, so it's kind of coming back upon us to pay for that ourselves.
Yeah. Okay, thank you.
Just for a little clarity, I went ahead and ran the numbers based on the JVCT project that you put forth. I'll start over with my mic on. Just for a little clarity, I just ran, some basic math numbers on the JVCT that we approved today. That's going to be going back to the state. In here, you say total revenue not to exceed $4,764,500. You also say there's one-time startup fees of $2,895,786 in there. So those would automatically get subtracted. So I went ahead and did your 578, 488 times 3 for 3 full years within that contract time, and it left. And then I subtracted that from the total that I just was left here with on basic math. I'm sure there's a couple of factors that are minor, but I came out with $133,250 left over to work through the beginning or the end of this fiscal year. So somewhere in there, based on the numbers that the sheriff's department's put forward, I'm seeing a correlation with your number. I'm off a little bit of what you have, but for the rest of this year, it's in the vicinity of $133,250 based on the information that's presented here.
I didn't do the math. I will defer that to Oscar.
Is it possible that I can share my screen, please, so maybe we can all just get on the same page by looking clearly at what the request was?
Yeah.
Cool. So, right. Okay, so this was the budget transfer that we received. Can you all see my screen here?
It's so small, Krista, that we can't read it.
Let's see. Can you see it now?
Yes.
Okay. So I think we're saying two different things, or the same thing two different ways, but this is the revenue that was requested for us to budget for this year further to the JBCT contract.
Wait, can I hold you up 1 second right now? That $173 is revenue that was paid to the sheriff's office by the state of California for housing inmates because of COVID. That has got nothing to do with the JBTC program.
All right, forgive me, I'm sorry, Sheriff. Regardless, we come down here, the $261,000 is part of the pass-through of this. The $30,250 is for the jail infrastructure improvements, and this $30,250 is also part of the pass-through that would go to WellPath for one-time setup fees. So when we talk about the jail and the increased revenues and the expenditures, that's why. And so when we hear that it's correct, this is what we recommended in our memo, and this is not an OpenGov issue, although historically in the rest of the year during budget development, we do use OpenGov, but not for mid-year budget. We will look at what is requested. And so, of course, we're going to recommend this pass-through amount, that pass-through amount, but to the extent that there's discretion, for example, adding positions in different budget units, that's where we make the recommendations we make. So if, I'm going to see if I can do a new share. Here we go. Sorry. Can you see my screen now? Is it small again?
It's the same screen, Krista.
Oh, shucks.
Easy. We can't see the bottom line.
Can you move it up just a little bit so we can see the bottom line that shows like line 43? We see line 42, but...
Yeah. So there's line 42, there's nothing underneath there. I've got another spreadsheet though that shows what we are recommending, and what we are recommending is on
While waiting, Mr. Garamendi, do you have something?
Mr. Chair, we have our administrative office and our largest budget unit not agreeing on facts, which makes it very hard to negotiate a solution for all of us. We can do this at any meeting. We had this in last year's budget, and they got together overnight. The next morning we had a plan. This is awfully hard to do in real time when we're not agreeing, and Krista's in the other room. I'm not sure how we're going to get this done, Mr. Chair.
I'm in agreement. I mean, all in all, there's not a correlation in budgets right now. I did say earlier that we would like to come back to this at the end of the meeting. Are you done with your presentation for now, Mr. DeBasilio? And I'm not to say that, one way or the other, but, we need to go through the rest of the mid-year budget. Maybe during that time, if you have an opportunity to get in the back room, and maybe we can get on, with Ms. Von Lott or on the phone, and, work on this a little bit, but we got other business we need to look at before we come to a decision on everything.
Absolutely.
Okay. My apologies.
No, that's fine. Don't apologize. It's part of business.
Mr. Stopper, we don't need to do this today. They don't have to resolve this today.
No, they don't need to. And all in all, Mr. Garamendi brings up a very good fact. We don't need to make this decision today. So if there's, some discrepancies that we need to iron out before we so we can make a valid decision, we definitely should work forward on that and bring that back before the board during a subsequent meeting, which could be next week because we don't have a Tuesday scheduled meeting. But Mr. Toffenelli, do you have something you want to say? Ms. Fullendorf's got her light on. Oh, okay.
Good. I just wanted to point out to Jim that and Oscar, that 581-00082 is SRF fund. That's that one, yeah, okay.
If you're ready, I have an answer for you.
Okay, thank you.
Okay, that was a grant fund specific to drug endangered children that was housed at our narcotics unit. That fund was reduced to where it wouldn't satisfy the full FTE cost of an employee. It was less than. In addition, as I mentioned earlier, we were short-staffed on patrol, so we chose not to fill it. So it is built over time. So it is a fund that we could bill back towards for drug endangered children investigations. But also during that time frame, and this predates Mr. Flamenco, during that same time frame, it was no longer a competitive grant process. That money was allocated to us. So while I think I hear what you're saying with the SRF fund, it doesn't mean we can go out and purchase vehicles or other things with it. And I apologize for not being able to answer what that was immediately, but when it changes from CalEMA to DEC, the acronyms, I was having a hard time keeping up with exactly what that was. So that's what that is designated for. I just stepped out and had a brief conversation with the lieutenant in charge of that unit to see how we've been managing that. And so while I appreciate you bringing that to our attention, I don't think that specific fund is going to offset what we're talking about here today.
Thank you, Jim. Thank you, Oscar.
Ms. Fullendorf.
If this comes back, one suggestion or comment to consider, would it, if you could separate general fund versus the contract, because at least for me, it's getting confusing in this talk back and forth of what we are trying to approve with the contract and looking ahead for the next 3 to 4 years with one time, and then versus general fund. And why that is, if there's other departments coming up, how does that general fund request level to the considerations we have to make with the rest of the departments that are going to propose? If that makes sense. Then that way we're making a decision based off of the contract, and we're not because to me, looking at this, it just gets too jumbly. And I think separating them out, so then we can see clear what your request is, and then say Public Works and everyone else, we can better accurately make our decision. And then we can argue over contractual decisions or disagree contractual decisions based off of that other grant or grant money.
Good point, Ms. Fullendorf. And I would add that, if you're going to do any AB 443 money, that we say that goes to that, and then for example, the $82,000 that will be reimbursed, that's technically money that's going to come back into general fund monies. So, if that's the way we're spending it, so that should be line item there to come back later with the request so that we can see that clearly.
I can lay it all out for you. It's very easy to do that. Just keep in the back of your mind that the CAO's office is wanting to use that new general fund dollars because the revenue that the JBTC program is going to bring in, the net amount that the JBTC program is going to be bringing in is well over $500,000. The request that I'm making is going to use up about 375 of that. They're wanting to put the rest of that money or that money into other areas. Now, I understand Ms. Von Lotta's concern about, how soon is the revenue going to come in? I get that. How long is it going to last? Is it going to be complete every month? So I understand all of that. But I've been assured by the state of California that this program is not going to go away. So I will sit down and do exactly what you asked, Ms. Fullendorf, and lay out everything, and then it'll be up to you to make those decisions. I just don't want the CAO's office pulling revenue that I'm going to be bringing in when I'm trying to do something with that. So it's not costing the general fund dollars now. It's new money, but it's not costing us now. And I'm trying to move our department forward with a succession plan because we have people that are going to be retiring here in the next couple of years, and I need to get people set up so that we're not vacated. So there's a whole reason for it. It's not just because I want to do it. I'm trying to do it to keep our department whole and move it in a progressively forward position. That's all. So, but I will bring that back to you, and I will work with the CA's office. We've always worked well together. And if we don't, we'll just go back behind the shed. Is there anything else for you folks?
You got rid of the shed.
Yes, you did. It was.
Thank you.
Stop. Is that it?
Yeah, no,
All right. I'm sorry to take up so much of your folks'
Mr.
time.
Garamendi, your light's on again.
No, sir, it's post, once the sheriff's done, I just have a thought.
Okay.
Mr. Chair, I'm challenged by this whole, this is, I've done this is my fifth budget, I guess, fourth budget, and, while I've been on this board, I've watched the mid-year budget go from something that was sort of a cleanup, where we take care of major issues, to now it feels like we're doing the whole budget cycle again in June and February. Some of these things that we're dealing with would work themselves out. We've always held the units, held them harmless for the MOUs that we've come up with at year end. We've always, we've got items that we're going to be taking on that are $400 adjustments for standby fees, which might work out at the end of the year. That's why we have a year-end closing process to sort of work this out. We're making decisions based on projected revenues on things like TOT. We're projecting that we're going to get lots of money, and we're budgeting it out at mid-year, not really knowing if tomorrow the state or federal government shuts us down or what's going to happen. It seems like we've gone from setting an annual budget and then making emergency tweaks, which, I would argue that this would probably fall in there with the sheriff's new contract. But I think this whole process seems to be getting away from us. I don't know what the rest of the board thinks, but it seems to have been organically growing this way. And I think, for people like me who've been on the board, I have to own some of that. But it is what it is now.
No, and that's why I brought up earlier. It's it's not all counties work in this fashion. They address certain issues, but they hold off to the annual. But I agree with you 100%. But with that, what's your suggestion, Mr. Garamendi?
I would personally like to just take on the things that have to be done mid-year. I don't know what those all are on this list, but I guarantee they're not trying to sum up, $400 for standby pay. Not to pick on environmental health or Lisa, but it's just an example of things that I just don't think we ought to be doing at mid-year, because we don't know what it's all going to sum up at. And I really have a hard time. We make a guess at the beginning of the year. This year we guessed that we we're going to be down TOT by 50%. So we budgeted $747,000 to be split in those quarters. We have issues like, if we get in more money, are people entitled to that? I don't think so. I think you get a budget and then we'll see what we've got at year end. But, we've sort of had this organic process that's evolved, and I think we kind of maybe need to consider some sort of reset for some of these. But that's a board policy question.
No, I agree. Ms. Fullendorf.
Is there a policy procedure that we just don't utilize, or is that part of what the strategic planning is for?
Well, I think the strategic financial committee that we discussed is part of that point. There's many factors within this county that need to be addressed that haven't been for a very long time, and I think that's part of the overall strategic plan. But that's a whole other discussion beyond our budget today.
I mean, Mr. Chair, it's easy to know how we got here. I mean, we had the Butte fire, we had unstable budgets. Now we've got a relatively stable, good budget. And it seems like maybe it's a good time to check out if we do have policies and are we paying attention to them or processes. I don't know. Gary and Marita, you've been on this board a lot longer than I have. You've seen a lot more miles. I'd be curious what you guys are thinking.
It seems the same every year, as long as I've been on the board. Midterm budget, your microphone.
It seems to be the same in just about every year when we get to midterm budget, and sheriff is generally one that comes to the board and asks for things, but the other departments do also. So it just depends on the year, whether we're having a good year, the budget was healthy, and most departments are comfortable with what they have and what they're working on. When you start reducing the budgets like we did this year by 5% or 5.3%, when you get to midterm, then you're going to have more departments coming to you or having requests because of the funding wasn't as robust as it was previous years. So it just kind of goes like what it is. I'm sure we can look at policies, but I'm not sure that's the correct way to go myself, because again, each year is different. Each year is Marita knows, they're not the same. We could still have problems this year by the end of the remainder of the year, depending on what the governor and legislature does to fund what they're trying to do, and withhold funding from us. So it's just year by year as we go forward. But guaranteed, year by year, as long as I've been on this board, midterm budget, the sheriff is here.
Right. It's been as long as I've been here too. It's just, this one seems a little more speculative than I've seen in years past. It's just my point. I don't know the answer.
Well, I think if they can meet with the CAO's office and get straightened out, I think it was just a miscommunication maybe on what this contract was going to bring in for the remainder of this year versus what a whole year is. And then projections going into next year on the funding. If they can get with the sheriff and ask what his needs are and his requests, even for next year's budget, where we have the full $500,000, $600,000 that they're going to bring in, what do they want to see it used for, and get it placed where they want to see it used, will be a lot easier on us when the time comes.
So we're all on the same page. We need the sheriff's department and the CAO to get together and iron these things out before we make a conclusive decision. Shall we proceed with any other department requests, and then we can put those down on paper, or have them get with administration also? Is there any other? Mr. Toffman.
Well, we have attachment A that I think we need to go through, which is what the CAO's projection or his recommendations for department request. And then after you go to that, you move down, there is a couple more that are requests by departments. I think there's IT and HHS. I think there's 3 of them. One of them is also the sheriff, that they're requesting in addition to what the recommendations are by the CAO. So if we can, I think we should go through those, because those are what we're actually being asked to address today.
Yes. No.
Along with capital assets.
I'm sorry.
Yes, sir.
Just before we get to the requests, I do have a couple of challenges that I've got with this budget. We've allotted a whole lot, $735,000 additionally to this budget in TOT, and it's projected TOT contribution. I don't think we ought to budget like that. And besides that, we're also giving out 25%, so it's a proportional increase. And this is something we should have cleaned up when we did the ballot initiative, and right when we started handing this out, but we didn't. And I think it's highly speculative to project what's going to happen in TOT and budget it now before we have it.
I agree.
I just don't think we could do it. I think we ought to, and just because we have an extra dollar in our pocket doesn't mean we have to spend it.
Well, and that was the point I was going to get to at the end of the meeting today, is we need to start planning for things so that we aren't cleaning up the MOUs at the end of the year. I mean, that's part of it, but that's all part of the strategic planning going into the future.
So when we get to, and how it relates is if we get to the requests, what is the bottom line number we're working off of, so we know how much money we have. Because if we don't do that TOT, we just took $750,000 off the plate.
Well, that's not all TOT when I read revenue.
It's on item number 13.
What is the package page number?
It's attachment A, item page 2 of 4.
I printed mine out here and I have to go to this.
The bottom, do you have the bottom page
It's in
package?
in the
Oh.
spreadsheets.
Oh.
And
I'm sorry.
it's,
It is attachment A, page 2 of 4.
Yes, sir.
So going off of what Mr. Garamendi said, what is our bottom dollar? I mean, when we consider these requests, and that goes back to what are the procedures and the policies about it, what percentage of those projections are you allowing to make these decisions against to the end of the year? Is it half of what the projections are? Is it a third of the projections, and then the requests are, and these things are decided, or is it the whole projection? And how are these submitted for us to consider based off of those projections? Because with the county increasing the TOT this past year, it doesn't necessarily mean there's money. The cost is going up, and this doesn't even cover the cost of what the decisions are going to be going forward with things in the future. And there's no answer. It's just those are the when I think about policies and procedures, what are we working with? We working, what part of those projections, and what is the process to make those decisions for us, so we don't we have something in case there's another emergency.
I will.
Just dialogue of how am I expected to make these decisions if I don't even know what the bottom dollar is?
I will say this, and I see what Jack is saying, but you got to remember, other than cash carry, most of all of our general fund budget is projections. It's all projections of what we think we're going to come in, what we think we're going to get on property taxes, what the projections are. It's all projections. And where we run into trouble is why we have midterm is to see where we are on our projections and how we're doing on it and how close we are. If we're not there on what we projected, bottom line, then we've got to make the adjustments for the remainder of the year so we're not operating in red and taking contingency funds or reserve funds out to just catch up to the end of the year. So everything is basically a projection.
No, Gary, I totally agree. It just, I think my problem with it is we set the budget on the best projections that we can. For example, going back to TOT, $700 and some $44,000, whatever we did last year. Now we're saying, instead of working within that budget and saying, okay, at the end of the year, this is what we're going to do this year, and we're going to see where we're at the end year, we're saying, we're up right now, so we're going to give you that money today, and we'll give you a little bit more because we think it's going to be good. We've already set the budget. If we were under or something, then we'd be scrambling. Right. This is a good problem to have, but I just don't think we ought to just start handing it out proportionally without going through a bigger process. I'm sorry.
I mean, if we go to, I'm on my agenda packet because I made all my notes here and printed it out before I came in today. So 33A, page 4, and these are December 31st, 2020 revenue actuals. And this is what I've been basing my decisions off of. Not projected for the rest of the year, what our actuals are to this very point. And my understanding is that's what the attempt by the administrative office was to paint the canvas that we're in today. Still, it says here, numerous general fund revenue projections were reduced, including reductions to Prop 172, transit occupancy tax, and sales tax in the aggregate amount of approximately $167 million. I would go on to say excise tax revenue projections were reduced by 40%, 1.43 million. I need to get back to where the TOT came in at this point at over 50% of the entire projected year. So, those are the assumptions that I'm making on working from here. Revenue in hand. Yeah. Although we have some adjustments, it looks like, to do with the sheriff's department on their end of this. So I'm in agreement with Gary. There's stuff here that, we have to go through that the CEO office has recommended, and we have to decide if we agree with all those recommendations at this point. Some of them are such a minuscule amount. I do think some of these come out in the wash at the end of the year regardless. And that is a choice the board can make. It's like, look, when do we do this? And we could choose to wait till the end of the year. Is that the appetite of the board right now, or do we finish doing what we're doing?
Mr. Chair, since my light's on, if there was, go ahead, Amanda.
Sorry, I don't think it's fair to department head to change it now when they didn't know, but I think going forward, yes, there should be a consideration of how this is decided, so it's not going through an actual budget. And what are our expectations as a board with these requests coming to the CAO's office? Because how are they vetted? What we just witnessed, we don't know because there's no policy or procedure in place. What do they meet? What criteria are they meeting? Other than emergency, mandates, legality, and contractual agreement like MOUs that we need to figure out. But what are those? I mean, there doesn't seem to be an answer. It's just based off of projections. And then it holds not only us accountable, it holds so we know how this is working.
Some of these are valid needs to address now, though.
You asked my opinion. If there was if there's an emergency we need to address, I'm happy to do it. Am I willing to buy building a cheap four-wheel drive for $30,000? I don't see that as an emergency, and someone would have to tell me why that's an emergency. It's in the budget. So I would do whatever the minimum was and then have a real budget process. I'd punt. That's just mine.
Ms. Calloway, your light's on.
Part of it is that things do happen during the year to departments, but Krista, I have some questions. You ready?
I am.
Okay, on packet page 715. Number 6, the economic development budget, an unrealized grant of $23,000. Did that mean that the general fund paid for the project that the grant was supposed to pay for?
So what that means, I'm just scrolling here. What happened with the economic development budget was threefold. The first thing that happened is that they were over budgeted in revenues by the amount of $23,000 for grant funds that ended up not coming in. The budgeting of those revenues was not accurate and ended up being a mistake from last year's census grant funds. So in reality, that was a negative $23,000 to that budget unit. The other two issues, however, one of which was an issue with the PERS unfunded liability, and this is not something that I think we've discussed yet with the board at this point, but across all budget units with staff in the county, the difference was only $10,000 across all budget units. So the calculation was sound. What wasn't sound is that due to an error that we believe has since been rectified, the proportionate weight that hit different budget units was not in line with what their staffing actually was. So most departments could absorb that. There were a few departments that could not. Economic development is one of them because it is almost exclusively staff costs. And then in addition to that, on top of that, I should say, was the 5.3% cut that budget unit in a good year would have difficulty absorbing. So between those three things, there is an ask that is on the order of $35,000.
But the 5.3 and the PERS unfunded was common to many of the departments.
The PERS unfunded, not so much. The 5.3%, yes, absolutely. The difference is that when I look at, I'm just pulling it up so I can give you actual numbers.
I mean, the coroner PERS unfunded, and that was just item 5.
Right, and the coroner has a very similar problem. There's just not a lot of
okay.
There's not a lot of extra money built into these budgets.
Okay.
So, yeah, they both got
All right.
affected similarly.
Thank you. I want to move to number 11 on page 716 for the admin budget due to PERS unfunded liability, et cetera, and the payment for the federal advocacy service. Considering that Miss Rich is gone and Tony's leaving, can't the admin absorb the 10,000? Plus there was that contract from Host to do the TOT evaluation. We'd be going into what, our second year now? Is that,
so there's, oh, sorry.
no, is that something that we need to have fully like we did at the beginning when we approved the contract? I was just wondering why admin couldn't absorb that.
So there's a few things going on there that I'll try and unpack. Please let me know if it's not clear. So the host compliance contract is actually budgeted for in our general revenues budget unit. It is, I believe, other than $10 of rounding error, the only expense budgeted in that budget unit. That is also the budget unit where the TOT revenue flows into. So none of those revenues hit, or it's the TOT host compliance contract hit the administrative office budget. So as it relates to salary savings, we are seeing some salary savings. However, we also saw a payout to one employee who is no longer with the administrative office for vacation and other time. So that was somewhat of an offset there. We are bringing on, we will be back to full staffing with the exception of that one position by the middle of March. In addition, we took the same 5.3% cut. What I will say is that the 10,400 is not actually the delta. Perhaps I should have made this clear in the memo. That is actually a low number and only accounts for the federal advocacy portion of what we are concerned we're not going to be able to absorb. As a practical matter, we may well be able to absorb it, but it's certainly not clear at this point.
Okay, thank you. I want to move to number 12 for OES. It was just a question on this. Did we pay the chamber to do some work for OES on pandemic services? I remember the remediating the oil spill, but I was just curious.
So I would just, yes is the short answer. I would need to defer to our Economic Development Director and OES Director for more specifics, but we did partner with the Chamber and our COVID response, and that invoice, which I believe has been paid, was for staff time associated with that response.
Okay. Also, they can just get back to me online. I was just curious. On page 7, page 726, on the Murphy's Benefit Basin, it shows, is it 726? I think I have page. There's the Valley Springs benefit, the Copper benefit, and then there's the Murphy's Benefit Basin. We were going to pay out on that, and I didn't notice it here. And what was expended this budget 6-month period, and if we've paid out on that benefit basin. I knew there were some negotiations, so that wasn't on the form. I was just curious about that.
Okay, so let me, just give me one moment, and I will look that up.
And as we just sort of, I'm going to just sort of generically ask this as we move forward, are you going to, at some point, do a recap or just a study session or an update with the board on COVID and what's been spent? That was mentioned earlier by one of my colleagues. So on page 718, we've talked, about the fiscal impacts of the pandemic remained uncertain. And I didn't know if there might be just an update.
So we're certainly happy to do that. I mean, it's for the board, clearly to let us know what the intention has been up till this point. I think, let us take the example that some of us have heard of prospective new stimulus money from the federal government that may, in fact, make its way or be authorized at some point over the coming months. Were that to be the case, then we certainly would bring that item to board, likely as an informational item, just to let the board know that it was something we could expect to be talking more about. Likewise, with respect to the budget process, however, would the board like us to bring back an item specific to CARES Act funding across the county? We can do that. As your board knows, the balance of the CARES Act funding that we were able to, that we had appropriate expenditures for related to public safety and public health salary expenses. The delta of that is in our contingency fund, and the board has not released any of additional funds from that contingency account.
Right, understand.
If I may, I just got a message from Miss Davis, the assessor's office. Do we have any questions for her? She says she has a meeting starting at 3 o'clock. Not that, is there anything we have questions for her at this time, or can we come back to it at another time? Okay, so I'll let you continue, Ms. Callaway. My apologies. I wasn't trying to interrupt you. It's 10 till 3 and she messaged me.
Supervisor Callaway, when you're ready, if you'd like to go back to the Murphy's Lighting District, if you wanted to ask me a question there, if you wouldn't mind re-asking it, I would appreciate it.
Ms. Callaway, your microphone, please.
Can't remember. Page 726, okay. Yeah, we had the Copper Benefit Basin, the Valley Springs Benefit Basin, the Rim, but I was wondering where the Murphy's Benefit Basin was on this, because there were some costs incurred, and just curious. If not, that's okay. I will touch bases with Public Works on that. Thank you. We can move on.
Okay.
Thank you, Ms. Callaway. So, with that again, how does the board want to proceed? We need to reel this in, and do we want to continue on with these things? Do we want to move the meeting out because we have multiple questions to possibly next Tuesday?
Are we getting other presentations from department, or is this the request right in front of us?
For the most part, I assume this is a request. Is there any department heads or staff on right now that have anything that they would like to talk about? Thank you, Amanda. I mean, Ms. Muhlenberg.
Mr. Oliver has his hand raised.
Okay, Mr. Oliver.
Good afternoon, Chairman and members of the board. Doug Oliver, Chief Building Official. I just want to raise my hand briefly because I know that there are concerns, and we are considering holding off for a few weeks. I would say that in the case of the requests that our department is making, the vast majority of them are in response to moving the department and hopefully several other departments who are signing on to participate, moving them forward into more online services and direct electronic services in the realm of permit processing, inspection requests, electronic plan review. It centers on the equipment as well as some add-ons to our current technology. As you're aware, a few weeks ago, our department intentionally shut down front counter services to focus on implementing everything we could. We made good headway. But in order to fully move forward in this and give more flexibility to the customers in this county, especially as it pertains to over-the-counter permits and a lot of the residential repairs we're seeing happening, especially in the wake of recent storms, I feel that these components and many of the components that other departments are moving forward are imperative. And I know we might be able to parcel some of this out. But for the CAO-approved components, many of those are necessary to move forward. If we stall those for 2 weeks, it stalls forward progress for several departments. So I would just make the request that, as far as we can, move things forward where it's reasonable. I would encourage you all to consider that. Thank you.
Thank you, Mr. Oliver, but point well taken. So I was going to make a suggestion that we go through those one by one right now, and we pull aside those that we don't agree with, or the ones we do agree with, we approve those at this time. Mr. Garamendi.
I think I'd like to, since Mr. Oliver poked his head up out of the foxhole, I want to know why a $30,000 Jeep, we don't have any other Jeeps in the fleet, is a priority and emergency at mid-year budget. We usually do our vehicles during the regular budget, but this is on here. So I guess my question is, why is the vehicle a priority now, and what's up with the Jeep when it seems like we got a fleet of other cars? Is there some...
That's an excellent question, sir.
I'm on page, attachment A, page 3 of 4, item number 26 under building.
Yes, it's not a Jeep Wrangler. It's an SUV. It's an SUV that is necessary to replace 2 aging vehicles in order to make sure that we can accomplish our goals of 24-hour turnaround we need another inspector, and we can't put them in a vehicle with 170,000 miles that is constantly getting repairs. We have 2 such vehicles that are aging. The mileage is fit for some other departments to take on and manage, but for us who are driving all the time, they have been breaking down. They have been expensive to maintain. And what we're doing is we're swapping out what used to be purchased at 35 or higher 4-wheel drive pickups with heavy rear end and transmissions for SUVs for the lower regions of our county that don't have the snow accumulation or the rugged terrain. So we're taking a different tack. It does look unusual to see the name Jeep. In essence, what we're doing is we're shifting down a bit on the lower regions and going with something that's durable but not heavy or heavier like we've seen purchased in the past.
Doug,
Does that answer the question?
Doug, I got 2 points on that. One, if we're going to be using it for lower Calaveras elevations, you probably don't need 4-wheel drive. But second, is this a crisis? Is your organization going to collapse if we don't do this right now, or is this something that can wait till June? And I'm going to ask this for just about every item.
Out of everything that we were requesting, that was, I will admit, an opportunity to take advantage of making changes in the budget to move that forward. If that is anything on my menu that I would take off, I'm happy to do that.
Yeah, see, Mr. Chair, this is what's the problem with this process, is it becomes an opportunity for people to add on to their budgets mid-year. Thank you, Doug.
We've consistently seen it over the years, Mr. Garamendi. So, shall we get down to work and start working through these?
I do have one question for Mr. Oliver. Not only you're requesting a Jeep, I lost the page, but there was another item on there. But both of them are listed as non-general funds. So you're not requesting to use general fund dollars for those expenditures. Is that correct?
That's correct, sir. Nothing that I am requesting is using any general fund money. We are tapping our building reserves as appropriate to make repairs and improve aging equipment and moving forward with new technology.
Okay, thank you very much.
Thanks, sir.
So, should we focus on what's going to be out of the general fund rather than? But I agree with what Mr. Garamendi is saying, and that's where I'm also coming from too. But in the essence of time and fairness to department heads, maybe what we're more worried about right now is general fund. And
Mr. Oliver's paying out of his. I agree. If he's paying out of his reserves, then he's.
No, it's not. It's out of his reserves, but it's his county money. We're all still responsible, and we manage the inventory. If we're going to go, I am voting that we not do this at all, but if we're going to go line to line, then giddy up. Let's go line by line. And everybody's going to answer why this is an emergency that has to happen right now. And if they got a good reason, they'll have one vote for me. But I don't, if this is the way we're going to do it, then giddy up.
Right. Why don't we start with number one, Ms. Von Lapp, and that way we can work through these. And I think there's going to be a certain point where we're going to have to pull the sheriff's thing because we have money budgeted in there right now that is still up in the air on, what the revenue really is for this year.
So perhaps we could go, the request by request number.
Right. That's what I said. Let's start by number one. We're going to start with number one.
Extra hire, $6,833, environmental health. It's going to be a long day.
Yeah, way too long.
All right, so we don't want to go through this process? What's your suggestion, Ms. Callaway?
My suggestion is that we take the recommendation that Ms. Von Lotta's given us, unless there's something that particularly stuck out to any one of us, to make the change. Did somebody just
let it go?
That's Doug's office chair. It's notorious on
okay.
Mr.
I do
Oliver,
not.
You may want to mute.
I mean, I don't want to be here till midnight now. Are we meeting next week, Mr. Chair? Did you say we're meeting next week?
I think so.
And
I
that
think it's
if,
prudent at this time.
that we're going to be bringing this back next week anyway, because we've asked the sheriff and admin to work together to clarify any conceptions.
Yes, ma'am.
So if we're going to meet again next week on that, why are we going through this now? I'm not interested in going line item by line item.
I agree. It's going to take all day. And we're
all
not going
night.
to get anywhere. We're spinning our wheels on something that we do need to bring back next week anyway.
I'm in agreement with Marita. I mean, if we have attachment A here, there's what, 13 items here that are recommended. Just ask the question, does any supervisor have any issues with 1 through 13? If nobody has, I have one with 6, then we pull 6 off and we approve the other ones or what have you, moving through those to get through them.
Right.
And then there's 3 other ones that were personal requests. One of them was the sheriff. And then if anybody has an item on any of these other ones that are listed out as line items, the supervisor wants to bring one of those up and have a discussion for it. Otherwise, we've just approved what we have here on 1 through 13 and the other 3 that were requested by Information Technology, HHS, and the sheriff. I don't see going through these line items one by one.
Right.
Because most of those are all requests or...
Right, no, and I didn't want to go through those. I was originally talking about starting with attachment A, 1 through 13.
Yeah.
I don't think we need to go through the entire list over here farther down. I mean, that's a whole other thing.
Can we do the sheriff next week? Can we do this and then deal with the sheriff next week?
I think that's part of the point Mr. Toffenelli's making.
Okay, yeah, let's do that. Let's just, yeah. 'Cause,
Yes,
yeah, we'll be here all day.
Right. Mr. Garamendi?
Yeah, if we're going to do this again next week, there's no way that I'm going to throw a temper tantrum if we end up giving away an extra $900,000 in TOT that we don't have, and that we're giving out proportionally to 25, 25, 25. That money, they've got a budget. Yeah, we cut them in half. We can make them whole. But I think it would be really premature to give away money we don't have and then make assumptions that, we're going to increase the Visitors Bureau by how many hundreds of thousands of dollars? Is that really what we want to do? Because that's what this says.
Right, that's why we have...
So, do we really need a flatbed truck right now for mid-budget? I mean, there's a lot of extras in here.
There is.
And this is not, I think we have to be judicious and conservative. That's how I don't know. It just becomes a wish list at midterm. I'm happy to come back next week.
Attachment A, 1 through 13, are the things that the CAO recommended based upon needs. And that total is $353,229. So we're looking at 2 different things here, Mr. Garamendi.
No, he's adding in the revenue. That's a net number. So he's adding in this TOT number, monies, and then he's subtracting out. And that's how we're getting to a net of adding $353,000. We're making projections on what we're going to get.
I'm reading it here different. It says here that, and I'm not trying to be argumentative.
That's okay. I
Result
don't mind
of
arguing.
described requested adjustments, if approved, is a total reduction of general fund contingencies. However, given the increase in revenue overall in the general fund, the net increase to the general fund contingencies will be $748,192. So am I reading that upside down?
Well,
Jack?
I'm
Yes.
reading the numbers, not the narrative. So I'm going from the spreadsheet that came out. And I'm looking at the bottom, and it has increase appropriations of 1.420. It says increase in revenue of $2,522,000, and the revenue gets increased, through TOT. We could go through it all this week, whatever you want to do, Mr. Chair. I don't
want to go through that back page those back pages that you're talking about. That will take the week.
Well,
right now, there's 13 items that we need to address.
Yeah, I think, Jack, what you're saying, that's the overall on the spreadsheets, but that's not the recommendation of the CAO. I mean, we can go through those items and say yay, nay, yay, nay, 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 yay, okay, if you want, but that's not what the recommendations that were being put before us to approve these, other than those spreadsheet line items. And the narrative is saying that even though I'm spending $353,000, the overall general fund contingency will be $748 increase.
Yeah, that's fine. I'm just not going by the narrative. I'm going by the data. So I'm making up my own narrative by their numbers.
Those numbers on that back part is a total that I don't think are in what the CAO's recommendation is. I think that those numbers are representative of what we have here.
CAO is right here. You want to give an opinion now?
I think what Ben is suggesting is correct. While the revenue total is in there, the net of what we're recommending is the smaller of the two numbers, the 13 line items.
Well, look, if you guys want to vote on 13 items and get out of here, that's one thing, but I won't be joining you. That's fine, though.
Well, I assume your answer will be no on each individual and every one. At this time, the rest of us can work through on this.
I didn't say that. I said if you want to go through every single one, I'll work with you. I said that before, but if we want to just line item, take the narrative, and go with their 13, then I won't be joining you. You only need 4.
I think we're just, not to be argumentative, Mr. Durham, I think we're just reading two different things.
Probably.
Well, I'm going to start out with one. Request 1 is for the animal services budget. Animal services has been unable to absorb the budget shortfall due to the 5.3% for year 2021.
Mr. Stopper, I thought we were going to do this next week. I'm totally confused now what it is that's being proposed.
Have 10 minutes.
Okay, on attachment A, 1 through 13, are there any questions? Okay.
Okay, Mr. Chair, in order to save time, and Marita, Jack has given his view, if I make a motion to accept attachment A, 1 through 13, as presented to the board and what it is here, I will present that as a motion. If there's a second, then we can vote on it. If there's not, it dies for a lack of a second. But to go through each one of them, unless a supervisor wants to pull out an individual one, you can ask, is everybody in agreement on a 13, or does one supervisor wish to pull one of these items out from this? And just like you do on a consent agenda, we can discuss that later, but make the motion to take the other 12 or the other 10 and go forward that way. Otherwise,
I offer an amended motion. An amended motion is minusing out the sheriff's request, that we will deal with that later.
Right, and can we make it clear which items those portray?
Everywhere where it says sheriff.
on the 1 through 13, you have dispatch, which is number 10.
10.
You have I think that's the only one. That's the only one in there.
That is the only one.
So if we make a motion for items 1 through 13 with removing item 10, with the exception of item 10 to be discussed at a later date.
Yeah.
I think that's a reasonable motion, Mr. Toffenelli.
Okay.
Are you guys going to leave in Doug's Jeep?
Yeah, and I'm going on the basis of things happen during the year. They submit their budget, and it's all done by the end of May. We do a final one in September. Things change, situations change, and if they cause problems during mid-year budget, we'll remember it going into budget year next year, into next 21-22 budget. So I just have to respect that the departments are doing their job. If there's something I have a question or a problem with, I will deal with Ms. Von Lava on that. I believe I asked all my questions when I went through the items in the appendix. So I will second Mr. Tuffanelli's motion.
Amended minus 10.
Minus 10.
Okay, so we have a motion and a second. At this time, as amended, I would ask for a vote of the board. All those in favor?
Aye.
Aye. Those against?
No.
Aye. Okay, my mic wasn't on.
All right, so the adjusted
Attachment A.
to attachment A minus 10 passes on 4-1 on the CAO's recommendation. We're going to bring back the sheriff's budget next week for adjustments. Mr. Tofnell, is there something?
Yes, we also have 3 items that are personal requests, and number 1, I don't know if he's going there.
Yeah, no, please. I was going to bring those up, and everything else we didn't touch with it, because, there's, I'm sorry, I'm stuttering out now.
The one number 1 is the sheriff jail, so we're going to remove that one and not have anything to do with that until next week when we have that budget straightened out. The next one is IT, and I would support what they're asking for. It's only a $5,300 increase for a vacant accounting technician 3 position to an administrative assistant 1 position. So I would feel fine and okay on that. The other one is HHSA, which is non-general fund, and reading it and what it's saying is I would be in favor of that also.
Okay. So we'll bring it back next week, and that concludes our regular meeting, I do believe.
No.
I have a comment.
Public?
Yeah.
Ms. Fulmer. I'm sorry.
No, I just want to be clear though to the CAO's office, coming to the end of the year budget, into the new year budget, I think we need to do what Jack, Mr. Garamendi and I were talking about of how are these things getting vetted and what is the process so one department isn't competing against the other. And I think that we should really need to consider and use the end-year budget as a look-through for all of us to see what we need and what we're expecting to meet these expectations.
It would seem that the departments that didn't get in on the gravy train or just missed the boat.
I'm sorry, a response? So we're half in and half out. The history has been here that for mid-year, we do ask the department heads for their requests. That's our practice here. Whether or not that's a sound practice going forward, it can be questioned. I looked through as many counties as I could when I was sitting in my office when we were having this discussion. I don't see any other county that does it the way we do, and most cities don't as well. Mid-year is really intended in most cities and counties to be a report that shows our revenue projections, whether they're tracking with what we projected, and our expenditures at halfway through the year, and if there's any unexpected changes that we don't necessarily know about. In this particular year, we've now adopted, the board last meeting adopted strategic directions, one of which is stewardship. And while what I put forward was a list of things that would be in strategic planning, a lot of that was fiscal policies, adopting a budget without a structural deficit, having reserves that take into account disasters and risks that we have, et cetera, et cetera. We also talked about employee engagement and classification and compensation and an emergency fund and things like that, that really ultimately are going to have to get funded out of the general fund at the beginning of the year. And I would always advocate, much like we do in personal finance, we pay ourselves first, right? You put your money in the savings first, and we address those accounts in the first place. So we now have the requests of our existing process, our existing mid-year process, competing with the board's interest in being strategic as we go forward in our budgeting and funding priorities and expressing stewardship. And we don't have those policies yet in place. So we're now potentially going to run the risk, if we take all the actions that are put forward, of having to take those out of the existing budget when we do recommended, preliminary, and final. And at the end of the day, part of the problem with that is we consistently adopt a budget that's $10 million in expenditures over what our revenue projections are. So at the end of the day, we're going to have a lot of unwinding to do, whether we do it now in mid-year or we stop the process as we go forward in budget development and adopt the budget on sound fiscal policies. We've got a lot to do, whether it's now or going forward in the final budget. But one way or another, it's going to be a lot of work to do. And I think I think if I try to summarize what I heard Supervisor Garamendi say in my simple way is, if we do this all now, we might spend one-time money or revenues that we had to address some of those things going forward, if I've interpreted it correctly. And that is in fact the case. And we face it at preliminary budget and final budget as well. And we go through this process, in my observation, not only in all the board meetings I watched before I started, but the ones I've been here for, is we have an intense need at the final minute from this room, from the chambers, to try and spend more dollars than what we take in. And not only do we adopt $10 million more than what we bring in, we then still have the negotiations of what more we can add at the 11th hour. And that's not sound fiscal practices, even though that's what we've done here historically. And as we move into thinking strategically, we're going to have to make some changes, and really tough changes that are going to cause some reductions in our expenditures in the long run. And really the policy decision, if we're going to go that route, is do we do that now at mid-year, or do we do that when we go into budget development and the budget that we put forward in the coming fiscal year? The tough choices today or 4 or 5 months from now.
I do agree with Mr. Garamendi and Ms. Bollendorf and Mr. Alt, for that matter, on the mid-year budget issue. I mean, it's definitely a past practice that has continued, and I would hope that we could adjust that and do a more sound final budget, I mean, for the fiscal year, so that we don't have to do anything but hit the unknown adjustments that come around at mid-year and potentially get an update. I mean, it's common practice with anybody that runs a sound financial home is, if I don't have the money, I don't get to spend it. If you get too far down in credit and you're spending the money faster than it comes in, you're gonna be upside down very, very quickly. So it's a very, very good point. With that, we're gonna, unless there's any other comments.
Public comment.
Oh, public comment. No, we didn't. We already voted. Any public comments?
No, there is none at this time.
Which is, when did it go in? It would be appreciated, Mr. Toffman. Comes to, let me grab my thing. So with that, we'll move on to supervisors' announcements. In compliance with Government Code 53232.3D, board members shall provide brief reports on any meetings attended at the expense and local agency and may make other announcements or report out. Mr. Garamendi, your light's on.
Thank you. I did meet with Ms. Calloway, and we talked about the animal shelter, and I think we ought to continue to push that forward. I was kind of hoping that maybe part of that $245,000 we just gave to the Visitors Bureau could help get some of that down payment, but hopefully we could bring it up on the next agenda item.
We didn't do that.
We didn't? We just increased the appropriations.
You're reading a different part than we are. That's not on here what we approved.
Okay. I'm just going by attachment A.
Right,
Dan.
yeah, no, and I understand that.
Attachment A.
I understand that, Mr. Garamendi, but that's something that we just read off on here, 1 through 13, if you read through those.
I'm happy to be wrong.
That's not on there.
My point is, I think we ought to talk about the animal shelter.
Right.
I'd like to bring that forward at a meeting in the future.
Absolutely, I agree with you 100%. It's something that's been always talked about, and, you know, we need to come to a point where we make a strategic decision on how we're going to move forward with it. Absolutely, sir. I will make sure that gets on a agenda.
If
sooner
we,
than later.
if we meet next Tuesday, can we put it on next Tuesday's agenda?
Mr. All, I mean, at that point, we're putting it together for discussion. I mean, we don't have much for, well, I guess we have the history of everything that's gone through, but what would you like to
Mr.
see?
Garamendi and I just want money.
Just
We did just get a new printer, color printer in the admin area, so we'll work on printing of the money. But from the ad hoc, you know, we've given the updates on where we are on the animal services. From a staff report perspective, it would just be an inventory of where we're at and a report out, and that certainly we could review that again. But we are really to the point where it's a policy level decision of the board to decide, will we allocate funds to however we would go forward with the animal services or animal shelter. We all know it's an important initiative, but we're to the point where without policy direction, we can't do much from a staff perspective. And so I think it would be a discussion item for the board to have relative to how they want to move forward. And I certainly could put forward what I think are options for consideration, but that's kind of where we're at.
Discussion and direction. Okay. I think we can probably get something on there. Mr. Toffanelli, do you have anything to report out, Ms.
It
Calloway?
doesn't have to be next week, it could be the next board meeting.
Right, understood. Ms. Calloway, anything to report out? Mr. Toffanelli?
I have nothing to report, Mr. Chair.
Ms. Fulenbrook?
Yes. I attended the CAMRA. They had a presentation by PG&E, and CCWD also did a presentation on SIGMA.
I showed up through the Motherlode Workforce, which is a joint meeting of the Motherlode Job Training Agency and then their subsidiaries with both boards together. Lots of discussion there, and also my Economic Development Committee, which comprises the Alpine, Mariposa, Amador, Calaveras, and Tuolumne. Another good discussion meeting. You know, there's things coming down the pike with grants and plans. I'm working with Kathy Galino on a lot of these issues, and most of the counties, we sit here and talk about our budget, our TOT, you know, isn't bad, but Mariposa said that, you know, them being right next to Yosemite, they lost over $16 million from the general fund with the loss of TOT because Yosemite closed down last year. So we have issues, but we need to be thankful that we don't have an issue of a loss of regular revenue like that in our county. With that, I'm going to close the board. Oh, yes, ma'am.
Chair Stopper, can you clarify for next Tuesday, this will be a special meeting, and if so, time?
We'll meet at 9 a.m. That way we can get it done earlier in the day, hopefully, iron out those last few issues. I would hope to be done by lunch, so. And as Ms. Callaway said, we don't need to add the animal services to the very next meeting. We can wait till a later date, hopefully soon in March. So 9 a.m. With that, we'll close our meeting.
Just to clarify, we'll be going back into closed session.
Yes, we are going back into closed session. That works.